Okay, I'm reaching out to them now, and I will let you know in a few seconds.
Okay.
Okay, we're live.
Thank you. Good morning. Good morning, everyone. We're going to get started. So first I'll have to say things as required by state law. The state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come. Mr. Stitt, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present and obviously say one.
Good morning, colleagues. Happy to be here today.
Morning.
Councilmember Gilmore Richardson.
Good morning, Matt. Good morning, Council President, and good morning, colleagues. Happy Wednesday.
Yeah, morning.
Councilmember Green.
Good morning, Council President. Good morning, colleagues. I'm looking forward to another day of riveting budget testimony and hearings.
As advertised, sir. Yeah.
Councilmember Gim.
Hi, good morning, everybody. Good morning, Council President, and good morning, colleagues.
Good morning.
Councilmember Heenan.
Good morning, Council President. Good morning, colleagues.
Good morning.
Councilmember Johnson. Councilmember Jones.
Good morning, Mr. President. Good morning, colleagues. And Councilman Green, riveting.
I'm going to leave that alone. Good morning, sir.
Councilmember Ho.
Good morning. Good morning, Council President. Good morning, colleagues. Good morning, Matt.
Good morning, Councilman.
Councilmember O'Neill.
Good morning, everyone.
Good morning, Councilman.
Councilmember Parker. Councilmember Parker. Councilmember Kiona Sanchez.
Good morning. Good morning. I'm going to have to ride that positive wave because it was a violent day in the 7th Council last night. Thank you.
Oh, my goodness. When will it end, Councilwoman? When will it end?
Councilmember Squilla.
Thank you, Matt, and Council President and colleagues.
Good morning.
Good morning. Councilmember Thomas.
Good morning, Council President. Good morning, colleagues. Thank you for all your great work, and I'm looking forward to our dialogue today.
Good morning, Councilman.
Council President Clark.
Right. So before we dive into what I'm sure will be a very informative session, and as referenced by Councilman Green, also a riveting session, I'd like to say a few words about today's process. The coronavirus pandemic has changed the world, and that includes this council. We're not in the same room, and to be honest, I really miss being in the room with you guys, but, that's not something that's available to us at this moment in time. But we have a job to do, and the technology that our IT team has installed will let us do it in a way that allows the public to watch and participate. This new environment comes with some limits, however, which I want to emphasize to you. Obviously, our budget schedule is much more compressed given the time frame. The revised budget was given to us a relatively short time ago, so we will have to get as much in as possible over a period of approximately 5 weeks. Understanding, I want to thank all the colleagues for really supporting our efforts to move this along by a 5-minute question and answer. I'm going to ask that the members of the administration give clear and concise responses so we can take advantage of what little time we have left. So I want to thank you for that. So I also want to say that 1 o'clock every day the mayor gives his press conference. So we have been limited to around 12:30 before the feed from Channel 64 moves to prepare for the mayor's press conference. So as quickly as we can get in and out, the more we can cover. I do want to say we do have, I believe, 2 callback days at a minimum, Matt.
3 actually, sir.
3? Okay. In the event that we need to have some callbacks of departments, if we didn't get all the information or there needs to be some additional Q&A, so they are available to us and built into our schedule. So there's a lot to cover, and we would like to, if you have some additional questions, you can please forward the questions to Council's Finance and Budget team, and we will make sure that the administration receives them immediately, and we will get responses as quickly as possible. So it's time for us to get started. This is the public hearing of the Committee of the Whole regarding bills number 200-285, 200-286, 200-287, 200-288, 200-289, 200-290, 200-291, 200-292, and resolutions number 200-307 and 200-331. Mr. Stitt, will you please read the titles of the bills and the resolutions?
Bill number 200285, an ordinance to adopt a capital program for the 6 fiscal years 2021 through 2026 inclusive. Bill number 200286, an ordinance to adopt a fiscal 2021 capital budget. Bill number 200287, an ordinance adopting the operating budget for fiscal year 2021. Bill number 200288, an ordinance amending Chapter 19-1200 of the Philadelphia Code entitled Parking Tax by revising certain tax rates under certain terms and conditions. Bill number 200289, an ordinance amending Chapter 19-1800 of the Philadelphia Code entitled School Tax Authorization by revising certain tax rates, all under certain terms and conditions. Bill number 200290, an ordinance amending Chapter 19-2600 of the Philadelphia Code entitled Business Income and Receipts Taxes by revising certain tax rates under certain terms and conditions. Bill number 200291, an ordinance amending Chapter 19-1500 of the Philadelphia Code entitled Wage and Net Profits Tax by revising certain tax rates under certain terms and conditions. Bill number 200292, an ordinance amending Chapter 19-1300 of the Philadelphia Code entitled Real Estate Taxes to eliminate the discount for early payment of real estate taxes, all under certain terms and conditions. Resolution number 200307, resolution providing for the approval by the Council of the City of Philadelphia of a revised 5-year financial plan for the City of Philadelphia covering fiscal years 2021 through 2025 and incorporating proposed changes with respect to fiscal year 2020, which is to be submitted by the Mayor to the Pennsylvania Intergovernmental Cooperation Authority pursuant to the Intergovernmental Cooperation Agreement authorized by an ordinance of this Council approved by the Mayor on January 3, 1992, Bill number 1563-A, by and between the City and the Authority. Resolution number 200331, resolution approving the Director of Finance's Budget Stabilization Reserve Fund withdrawal certification for purposes of allowing utilization of $34,276,000 in a reserve fund for general fund purposes in connection with the FY2021 operating budget.
Thank you, Mr. Stitt. Before we proceed, Councilwoman Parker, I believe you're here.
I am, Mr. President. Thank you so much. Good morning, everyone.
Good morning. Okay, just want to make sure that you're listed as being in attendance. Thank you. Today, we continue the public hearing of the Committee of the Whole to consider the bills read by the clerk that constitute proposed operating and capital spending measures for fiscal year 2021, a capital program, and a forward-looking capital plan for fiscal 2021 through fiscal 2026. Before we begin to hear testimony from the witnesses we have today, everyone who has been invited to the meeting to testify should be aware that the public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this particular purpose. Today, we will hear testimony from the following city departments, and later this afternoon, we will be hearing testimony on the public comment session on proposed city budget matters. Today, from the administration, we will have the following departments: Department of Health and Human Services, and the Office of Children and Families. Mr. Stitt, who will be the first individual to testify?
Dr. Tom Farley, and Behavioral Health Dr. Jones.
Thank you. Good morning.
Good morning, Mr. Council President. Now, it was my understanding that I wasn't going to have prepared testimony. I was only going to answer questions. If I got that right?
Doctor, however you feel most comfortable, we're okay. You could just kind of go ahead, and we appreciate the numerous questions that we're going to be getting from members. So.
All right. I'll be happy to answer questions, but I'm sorry if I misunderstood this instructions and advice. Let me simply say that we are facing an epidemic of magnitude that we see about once a century, and that has caused us to upend society, as you've seen, to address that problem. As everyone has seen, we have gone into a stay-at-home order to reduce the transmission from one person to another. Over the short term, we have succeeded with that. We greatly first flattened and then reduced the number of cases we're seeing every day. And with that, although we have lost far too many lives, at least 1,200 lives that we know of, many people have become sick, many people have been hospitalized, but the numbers are trending in the right direction now, and we are approaching in what way may be tougher to do, and that's the tough decisions around what I'm calling phase 2, and that is how to gradually restart activities that we have stopped in the past in ways that don't allow the virus to resurge. It is very clear that the virus is still here. People are still people. People are still vulnerable. If we go back to our previous way of behaving, the virus would come back and potentially could have an even greater surge than we've seen already. And so we must do this very carefully, and we must do it in ways that we measure every step along the way whether the virus has started to pick up speed again. So we are approaching those issues right now. At the same time that starting to get back to our regular work. The rest of health has not stopped. We need to make sure that children are immunized and people receive healthcare services for other health problems. We deal with other health risks, and so we will do that. And so I'm sure there are many questions about the epidemic, many questions about how we, the city, are responding to that. I'll be happy to answer any questions that council members have.
Thank you, Doctor. And Dr. Farley, for purposes of potential follow-up, it would be helpful if you could have some prepared testimony forwarded at a later date, so as we make these decisions about the budgetary matters, we do have the ability to review testimony that was given. We have to make some very, very difficult choices, as you know. And second, I'd like to thank you. Yesterday's event on opening up the new testing site at 20th and Berks was well received. I want to thank you for keeping your commitment to expand those opportunities and allowing more and more people to be in a position to get tested. It was a really good sight to see those individuals, municipal workers, working at the site that is very familiar to everybody in the North Philadelphia community, and looking forward to working with them in any way possible that we can. Doc, I had a couple of quick questions and as it relates to your budget proposal, and there's been this conversation significantly about contact tracing, obviously to help us reduce the spread and get a real handle on this virus. So can you talk to me about how this particular budget proposal, given the challenges that we have with revenue, address the need for testing and tracing? And also, can you add to that? I know there's been a number of questions about the hiring of contact tracing, who's responsible, federal, state, or local government. If you can add that also.
Yes, so the expansion of testing, and we do need to expand testing, and the creation of the service of doing contact tracing is totally a new service that has real cost to it. And so I was very concerned not long ago that really we did not have the city funds to do it. We were asked, like other agencies, to cut our budget because of the revenue losses in the city. However, money that Congress allocated has gone through the CDC, and we received a grant from them to do this. We do think that grant will be adequate for us to expand the testing as well as the contact tracing. And so we're putting that in place right now. So the contact tracing in the city of Philadelphia, my department will take the lead in, although we will work with other organizations. A number have come forward that have an interest in assisting in some way. I think a lot of the work will be done by us, but some of it may be done in partner organizations. Let me just say that there's a lot of questions and concerns about contact tracing. Contact tracing is something we in public health have a long history of doing. We do it for sexually transmitted diseases. We do it for HIV. We do it for tuberculosis. I've learned a lot about how to make it as successful as possible. One of the key things is that it's a very personal conversation. You're getting into people's private business. And so you need to hire people who have good interpersonal skills and who the folks that they are working with are comfortable dealing with. So it means you need to hire people who are reflective of the communities that they serve. And so as the epidemic is affecting very diverse populations in the city, our contact tracers will be equally reflective of that diverse population in the city. And we think that's the only way for it to be successful. So we're building that team now, and we'll let council know as we go how this is all going.
Okay, what time frame do you anticipate being in a position to have that up and running?
Right now, we are hiring staff and piloting our protocols. We're hiring staff at maybe 20 per week. So I would say, let's see, where are we now? End of May. By late June, we're going to have a staff. My goal at that point would be to have staff to where we're getting, if the case counts go down, we're interviewing essentially everybody who has a positive test, and we're following up on as many of those contacts as possible. Probably continue to improve the coverage and quality through the remainder of the summer, but give us a month. I really feel like we have this in pretty good shape.
All right, so give me the specifics on what happens if there's an individual who is interested in being a part of this process, i.e., working as a contact tracer. I mean, where do you call? Do you call the Department of Health? Is there a notification for opportunities for employment? Is there criteria established in the document for the individuals that's applying? Give me a little more meat on the bone, if you can.
So there are job postings. These are all being hired as contract staff in order for us to hire them quickly. And so their job postings, I believe, through the Public Health Management Corporation and PMHCC, and I'm forgetting the words that acronym stands for, but the two contracting organizations. They posted on a number of websites, and I'm sorry, but I have to get back to you on the exact qualifications that are required for that. I would say the most important skills we are looking for are interpersonal skills. It's not really a technical position. It's someone who can work well with people. And so I'll be happy to circulate information after this as far as where it's posted and invite anyone who feels that they have this ability to apply.
And PHMC has a contract with the city of Philadelphia to provide this work?
Yes, but the two organizations.
And how were they selected? Was it an RFP put out, or?
We have existing contracts with these organizations to when we need to quickly have staff on board to do things, and so we working through those existing contracts. And again, it's two different staffing organizations.
And
those people will have their salaries paid by that organization. Ultimately, the city picks up the cost, and they'll function as if there are full-time staff.
All right, and the cost of the contract? And I'm only asking questions because we're in the budget hearing, so this is about budgets.
I'll be happy to get back to you on that. I mean, are you looking for the total cost, or what specifically looking for?
Yeah, I mean, we're in budget hearing. This is all about the money. There's clearly an issue with respect to public health, which is first and foremost, but, you know, there's money coming, as you said, from the CDC, and we're appreciative of that.
Right.
But how much of that money, what's the contract, what's the process? You know, you said there are existing contracts. These contracts should be amended, I'm assuming.
Yeah.
So, and I'm not going to understand if you can't answer those specifics right now. You're focused on the public health thing, but.
Also, Mr. Sammy Gerard, who's my Chief Operating Officer, I believe is on Teams, and I'm going to invite him if he can shed a little more light on the contracts we're using for this and anything about the process. Sammy?
Yeah, are you able to hear me okay?
Yes.
Yeah, so we have contracted, amended existing contracts with both Public Health Management Corp. And PMHCC, and they're each filling these contact tracing positions as we've described. That's funded via a grant from the CDC. It's called an Expanding Lab Capacity Grant. We made notice about that grant recently. That's a $92 million grant that's spread out over 2.5 years, and it's partially funding these two contracts.
How much did you say?
$92 million.
$92 million.
And just to clarify, Mr. Council President, that includes the expansion of testing as well as the contact tracing, and it's for 2.5 years. And we would think that the biggest chunk of that would go for the contact tracing because there's a lot of staff people involved in that. And so that has a relatively big cost.
That's a pretty significant amount, and I understand it's stretched out over 2 years, but to simply do it as an amendment to a contract is not normal in some respects to me. I think it would be a little more transparency associated with that contract. But that's where you normally do business.
Sammy, you want to just answer that?
Sure.
That's a big contract.
Yeah, so the $92 million is not going to these two organizations alone. There are many, many other functions that this $92 million is covering.
Yeah, I'm asking you to give me some specifics because I'm kind of doing this on the cuff without testimony. So it's $92 million. It was the federal grant?
That's right.
All right, and that will cover a number of things that we're going to be doing as it relates to this issue.
Yes, this is one among probably a dozen functions that grant will be required to cover.
Okay. Well, it would be helpful if you can provide that to us in an expedited way. Yeah.
Sure, we'd be happy to do that. I can also just say that we got notice of this grant about 1.5 weeks ago and haven't yet prepared the budget. The budget is due in about 3 weeks, so we're working on development of that budget, but we'll be happy to share it.
All right.
So, Mr. Council President, also, if I could just point out, we're in a real hurry to get contact tracing up and running because we want it to functioning really as we get into the yellow phase. And so using these existing contracts enable us to move fast. As we haven't even submitted the budget to the feds and we're already hiring folks. We have time later on for us to think about things where we have more time. But
I want you to move as expeditiously as possible because it is impacting significant parts of the community that I represent as a district council person. But I do have a responsibility to make sure that, we know how this money is being spent and who's in this being spent with. As you know, being very candid, the issue with respect to work being performed on this very significant issue, there's been some conversations about certain organizations that were trying to be a part of this healthcare issue and response. And there's been some back and forth between members of council, members of outside organizations, and who's going to have an opportunity to provide service. So I'm just trying to do it in a way that it's not contentious, but I do need to get a sense of how much of this money we want it in and out as soon as possible, but how it's being spent, because that's our responsibility. And when you can get it to us, that's fine, but we do need to have that information.
Yeah, we have to.
All right. Pretty much taking up all my time on that one question, but had to do that. This one quick question. It's a matter, in the overall scheme of things, relatively small in terms of dollars, but this is a very significant issue. There was a reduction in $200,000 in your housing-led remediation. Is that going to be backfilled in another way? Because this whole issue with respect to lead remediation is obviously very important. It precedes the issue with respect to COVID, but it's still very important. Do we have a sense of that?
So we had to make a number of very difficult budget cuts, and I believe that was one of them. We have had a period of time when we haven't been able to get into homes to do lead remediation. We're starting that now. So I don't know if Sammy Draw has any more light to shed on that. It's our intention to do all the remediations that we can do, and that hopefully that the budget will not limit us there. But I think that's was one of the tough calls we had to make, and I think we can handle that. Sammy, do you want to talk more about that?
Yeah, I think what Dr. Farley said is correct. I think it was two things. One, it was a planned expansion that we felt like we could cut only because the reality of COVID makes it difficult to get into families' homes. And so we felt like it was reasonable to give ourselves a few months of a cut, given the reality of social distancing.
Okay. Thank you. I'll come back. I understand now, Mr. Stitt, we have circulated the written testimony. All right, thank you. Let me start on the council members. First up, we have Councilwoman Gilmore Richardson.
Thank you, Council President, and thank you, Commissioner Farley, for your work during this time. And special kudos to Jane Baker on your team for her responsiveness and for always taking my calls, no matter the day or the hour. So we know that the health department continues to be a vital part of the city's continued response to COVID-19. And you already went through the testing and contact tracing and trying to mitigate a further spread. But I think it's important for us to go back in order to go forward. So on April 6th, there was an article in the Inquirer that detailed the analysis of a Drexel University epidemiologist who analyzed the data from your department, wherein Philadelphians who live in higher income neighborhoods had gotten tested for the coronavirus 6 times more frequently than those in lower income communities, which is a social inequality that continues to need to be addressed. So can you speak to how you have expanded testing since that time across the entire city, particularly in lower income communities, and what your plans are for continued expansion? And then my next question is, can you provide us an update I had on the RFP for community-based testing? And then lastly, and I'll have more questions after you answer that, your interface with the Black Doctors COVID-19 Consortium. I continue to feel as though there's a level of resistance from working with this organization. And you just talked about receiving $92 million in CDC dollars in order to expand testing and contact tracing, and that you have to ramp that up very quickly. But I think it's important that we talk about something that we haven't heard. We cannot act in haste and repent in leisure. So can you just speak to some of those questions?
Yes, thank you very much. So let me try to remember them all as I go through here. As far as testing, when the virus first arrived in the city, we had no testing available. Then we had very little testing available. Initially, we had just one drive-through site at Citizens Bank Park. And ever since that time, we've been trying to increase the number of sites where testing is available and making it increasingly available to populations that were underserved. We are now, the way that we have increased the number of sites is working with providers that have the ability to do testing and to say, how can we facilitate that? For the most part, those providers, what they mainly needed from us was the test swabs, because the rest of it they could do them, in some cases, personal protective equipment, because the testing itself they could do on their own. They can bill for the testing and get reimbursed. And so we initially worked with the hospital systems to set up testing sites. So University of Pennsylvania has testing sites, Temple has testing sites, Jefferson has testing sites that we've coordinated with. Then to make greater access to low-income populations and underserved populations, we worked with the federally qualified health centers and made a similar offer that, we will provide swabs as needed and if necessary PPE. Can you wrap up testing? They've done that and they paid for that through billing. So we have not had to pay them to do that, which was good because we did not have funding to provide them to do that. We also worked with some of the pharmacies have offered testing. So there's a big testing site at Rite Aid.
Mr. Commissioner, I apologize. I think you said you did not have funding, but just for the record, you do have funding now, right, with the $92 million from the CDC?
That is correct. It has changed. It has changed quite a bit. We heard about that funding about 10 days ago, and the ramp up I'm talking about now happened before we heard about any of that. So we worked with the pharmacies also to say, okay, there are other neighborhoods that are underserved that you can provide this testing. So through that, we're now up to about 50 testing sites across the city, which is pretty good. We need to do more. We've increased the number of tests we do per day through that from a few hundred a day to about 1,700 a day. Total number of tests done in the city since the beginning of the epidemic now is about 80,000. So we definitely need to do more on testing. One of the things we did was because we knew there was an interest in getting more testing and a need for more testing, so we put out a request for proposals, as you mentioned, as on May 12th, to say, if you are an organization that can provide testing to underserved populations of particular high need, then please put in an application. We were very clear at that time. We said, we do not have funding at the moment to do this. However, we had heard that the grant might be coming. And so said, in anticipation of that, we wanted to get applications in now so we could get the funding. We could offer that. So that RFP has gone out. The organization you mentioned, the Black Doctors Consortium, had done some testing before. They requested funding at the time we didn't have it. And other sites were doing testing without any additional funding. They received the RFP and they have put in an application and we are reviewing it.
Okay, thank you so much. And I heard the bell, so I'll come back on the next round. Thank you, Mr. President.
Thank you, Councilwoman. The chair recognizes Councilwoman Parker.
Thank you, Mr. President. And to Dr. Farley, let me say what I've said to you privately, Doc. At a national level, it's Dr. Fauci. I think the state level, and I hope I'm not chopping up this name, Dr. Levine. At the state level, and yourself, listening to the advice of medical professionals and trusting the science, that has been our focus to stop the spread. And I want to thank you, Jane, and all members of your team for the work you've done. But I've got to go back, Doc. This is in my crawl now, relative to this response about amending existing contracts with PHMCC along with the other organizations, because we had to get this set up and standing up immediately. One of the things that was said when the mayor introduced his budget is the city's focus on public health, public safety, and education, and that we would be using a racial equity lens in all that we did relative to this budget. But to find out that we would simply amend an existing contract and that organizations like the Black Doctors COVID-19 Consortium, they've been doing this work from the very beginning, that there was no way prior to the RFP being issued for them to be added to, in some way, for the work that they were conducting in the communities they were conducting that work in. I am appalled by that. Let me ask this question specifically. You noted that about 80,000 tests have been conducted in the city of Philadelphia. Do you know the number that were conducted by hospitals and then the number that were conducted by the city of Philadelphia?
I can get back to you. I think that when you say the city of Philadelphia,
I mean, I'm not, so Doc, hospitals are doing testing, right? And that is hospitals, but we as the city of Philadelphia, I've heard when I was talking to different members of the administration about the Black Doctors Consortium, they were telling me we were ramping up testing in our public health centers. I was talking about the African American community. There's a lack of trust historically, based on science and medicine, and I don't have to go back through the history because you know that well via your knowledge of the healthcare industry. But I want to know, how many have we conducted as a city at our public health locations? Because I want that number.
Okay, I don't have it right. I get that for you. I can't tell you that as far as hospitals, they're not just offering testing within the walls of the hospital. They, at our request, and they really stepped up, they're offering testing to the community. So, for example, the University of Pennsylvania has a site in West Philly that is the busiest site in the city. They're doing, on a typical day, more than 200 tests. It's drive-through, it's walk-through, so they are serving that community. That was the way that we got high volume up as quickly as possible.
Doc, what I would ask is, I'll wait for you to get that very specific, what the hospitals have done via all of their vehicles, along with what the city has done with city facilities. And I'll tell you why. The Black Doctors Consortium, they broke 4,500. And they've done this with basically no support. Don't get me wrong, Doc. I heard you talking about that we provided some PPE where we could. We provided access to some swabs. But the mobility and the trust factor associated with where they've established these sites and getting to a constituency that is not the constituency that has access to regular communication with the primary care physician. So once you get the test, they've also been able to recommend and attempt to connect people to get primary care follow-up. And so I would like to know, because it's very frustrating to me that we have African-American healthcare organizations in existence. But when it comes time to utilize dollars, we will amend and extend an existing contract without trying to figure out how we can navigate in a very transparent manner to provide access to other organizations, because they are also getting paid to administrate this process. So how are we attempting to build the capacity of existing African-American organizations that may not be as large, but have a trust factor that, quite frankly, PHMC, they don't have when they go into the community. So I want to make sure I get that on the record. I have a number of other questions that I want to send to you, but I also want to ask if you can provide us with a listing of testing sites by zip code so that we can map where are the tests being provided by zip code. And in addition to that, Governor Wolf has just proposed that Philly move to yellow on June the 5th. I want to get your opinion about whether or not we have enough sites open and protocols in place, and to get racial and ethnic data relative to the private testing labs, and whether or not they are mandated to report this information. And I'll send the rest of the questions to you in writing, because I don't think we'll get to a second round, but if we do, I have more. Thank you, Mr. President.
Thank you, Councilwoman.
So, Mr. Council President, can I respond to that, or should we move on?
No,
I'm happy to
respond. No, I need you to
so just on a couple of them, there's testing and there's contact tracing. And so that the contracts we talked about with PMHMC and PHMC and PMHCC are for staffing for contact tracing. The testing we've talked about, the scaling up of testing up to...
Dr. Farley and Mr. President, I apologize, but I need to state this for the record. I respected 1,001%, Doc, your perspective that the people doing the contact tracing should look like and have the interpersonal skills and have a certain level of trust with the individuals that they are working to trace. And in the African-American community, I want you to tell me how PHMCC is the best vehicle to hire the people and have relationships within the community to get that model standing up. If we're using a racial equity lens that was promoted when this budget was proposed to us in the midst of this crisis, we should have been intentional to make sure that including, as we begun the process, even if we had to use those two, because we had large existing contracts with them, we should have made sure that we found a way to bring minority firms. There are minority, African-American, Hispanic, other firms that are up that we could have brought in on the front end to participate in the process, because with all due respect, PHMC and the others, they are not the be-all, end-all with access to the minority community. And Mr. President, I apologize for overstepping my time here, but this is very frustrating. 4,500
That's all right, Councilwoman.
Council member, if I could just again clarify that those contract organizations are providing an administrative function for hiring contact tracing staff. They're not involved in the testing. As far as the testing, the scale of sites up to 50 sites has been done without any expenditures from this health department. This is sites because testing itself can be reimbursed through insurance. Testing is a medical service and it is reimbursable. And so a very large scale of testing occurred without any dollars at all. That has not gone through this. So these are a separate process. And as far as testing, I do need to point out the total number of tests, roughly 80,000. Of those, we don't know the exact racial breakdown of all of that because our data from lab tests is incomplete. About 25% of those, we don't know the race. But about 35% of those, and then 35% were African American. So probably about 30,000 tests were done at a minimum and among African Americans. In this organization, Black Doctors Consortium, did some testing for African Americans, and we think that is great. We are appreciative of that, but it wasn't like they're the only organization out there offering testing to African American populations in the city. We need to do more. We need to expand the number of sites. We did not have funding in the past for testing. We now have funding for testing. We put out a request for proposals, but that is separate for the contact tracing.
PHMCC, if they were smart, they'd be calling the Black Doctors Consortium now and every other African-American-owned healthcare agency to say, we're standing up contact tracing and we need you to be a part of the structure of this process.
Thank you, Councilwoman. There will be clearly significant follow-up on this particular issue because I know that a lot of members of council are very concerned about this traditional issue with respect to expediting contracts that traditionally go to the ones that always are the go-to people, and it never opens up opportunities for new vendors, so to speak. But we'll talk about that a little further at length. But we do have limited time today, so I want to move along. Chair recognizes Councilman Green.
Thank you, Council President. Thank you, Dr. Farley, for the work that you've done in reference to addressing this pandemic. You mentioned 80,000 tests have been done in the city of Philadelphia. How many tests have been done by the city of Philadelphia, not other health systems, just the city of Philadelphia in reference to COVID-19?
I don't have that number. I will get that back to you. I should be clear that our testing...
No. My question is very specific. You said 80,000, and you're including a number of other entities. I'm saying specifically the city of Philadelphia. How many tests, as health commissioner, has the city of Philadelphia done for COVID-19?
I said I don't have that number right now. I'd be happy to provide that to you. I can say that the testing done by the city of Philadelphia is done in our 8 health centers. Our 8 health centers just represent a fairly small fraction of the healthcare providers that provide services for low-income populations across the city.
Right. So the reason I asked that specific question, because you made reference to all of these groups of testing, and then you had the perspective to say that the Black Doctors COVID-19 Consortium has done some tests. And as my colleague, Councilmember Cheryl Parker, correctly stated, they've done about 4,500 tests. And so to be very somewhat dismissive and say that they've done some when the city of Philadelphia has done, I'm not sure what the number is because you as the health commission don't have the information, but you do have the information for all the other organizations in the city of Philadelphia that are providing testing. So I think it's very inaccurate to take the Black doctors and say they've done some at 4,500 and then extrapolate all the other organizations that are doing testing, some 80,000 tests. And that tends to be people in healthcare networks that also have insurance in those networks and those providers. But I'll move on from that issue. I want to move on to contact tracing. Early on, and as you know, I'm a member of National League of Cities. I've been providing a lot of information to the administration, and I've been very narrowly focused on contact tracing, specifically because we've had a high level of unemployment in the city of Philadelphia. The Council President alluded to this earlier. So I've been very laser focused talking about contact tracing. I've talked about other cities, the Commonwealth of Massachusetts, others, and as well as cities around the nation have started to focus on putting together contact tracing. You've stated in your 1 o'clock press briefings that you don't feel comfortable until developing a contact tracing system so we get close to about 50 new infections per day. However, we're learning today that you're amending 2 contracts with 2 reputable organizations, but we could have been ahead of the game in reference to setting up the opportunity for those people who have become unemployed due to COVID-19 who possibly applied for these jobs for contact tracing. So I don't understand how the CARES Act was passed weeks ago. We knew it was coming. Other cities and states were preparing. At the point when it was asked about it, you said we have to wait till a later point. Now we're finding out that this process is already set up for contact tracing. I know Penn Health is working with the city of Philadelphia doing contact tracing. So can you explain that?
Not sure I fully understand the question, but let me just try to explain.
The question is, we knew funding was coming from the CARES Act. You said we had to wait for a while to develop contact tracing, but now we're understanding that contact tracing system being put together by amending 2 contracts. Why did we not start to be proactive and tell people what are some things we need for them to be hired to be a contact tracer?
Well, and the funding for this, we received notice of it about 10 days ago. We already started putting things in motion to hire people, even though in anticipation of the funding arriving, and we are hiring now and putting our protocols in place. The idea is to scale up as quickly as possible. As the case counts go down, then we hope that we scale up our ability to do this, and we'll meet around 50 cases per day, I hope. So I can say that we're doing this as quickly as we can. Doing it as quickly as we can, as you see, involves using existing contracts rather than writing new contracts, which can take a long time to do. So I know that
you're obfuscating the question. You, as a health professional, know contact tracing has been used by health professionals for numerous years, HIV and other areas. It's always been said from the very beginning of this pandemic, we need to make sure we have testing and contact tracing. So when we get opportunity to start putting together, start looking at a system of contact tracing, knowing that money was coming through the CARES Act with CARES 2, why did we not? I mean, the fact that we're just learning now that PHMCC is hiring people for contact tracing is crazy. The fact we have a high unemployment in the city of Philadelphia, and we now just finding out the stuff on their website for people to get hired. Why was this information not out ahead of time? We have to be able to chew gum and walk at the same time. So why are we just putting this together now when we knew it was needed weeks ago?
Well, I'm going to say, when there's no amount of staffing that would enable us to do contact tracing in an adequate way when we had 500 cases a day. That was beyond us. We were at that point, our basic strategy was social distancing, recommendation that everybody essentially was in quarantine.
We all know that. How at the same point, you know it was coming, because every other jurisdiction was also focusing on both testing and contact tracing. So we knew we were going to have a system of contact tracing set up in the future. Why were we not starting to tell people, if you want to interested in becoming a contact tracer, you need to have certain skill sets, certain backgrounds, start engaging people about this opportunity?
I don't know how to answer other than when it was clear that we had the funding to hire people as quickly as possible. We got job announcements out there, and we're hiring people as quickly as possible.
Okay, where are those job announcements placed?
They're circulated widely. I'll have to get you the details on where they're placed.
Okay, if they were circulated so widely, how come the legislative branch of this city is just learning about it today?
I can't answer that.
Thank you.
We're happy to give you more information about how.
We'll come back with more questions. Thank you.
Thank you, Councilman. I'm sure there'll be some follow-up on that one also. Chair recognizes Councilwoman Keona Sanchez.
Thank you, Council President. Thank you, Dr. Farley, for all of your team for all the work that they have done throughout this. I think the frustration you hear from our council colleagues is, as a legislative branch, we have a responsibility and an obligation to work with the executive branch, but we are not being consulted. We are being informed. The last act that council did before we started working remotely, we authorized an $85 million emergency COVID fund. Do you know why we established that fund?
I don't. I have not been involved in those conversations.
The $85 million fund was so that we as a city could do whatever was necessary to meet the health care pandemic needs of the city of Philadelphia. Do you not think that testing of the minority population, given the national statistics, was considered an emergency, and therefore, whether we had federal funding or not, should have been funded from the $85 million allocation?
Seems reasonable. Again, I do want to point out that testing is a reimbursable medical expense, and in general, we don't use city funds to pay for medical services. Medical services can be quite expensive, and to the extent you can have insurance companies pay for that, which is, get the money out of our premiums, that's a good thing.
It is. We have that challenge in our prisons and our congregate care as we try to get reimbursed for all of that. But in our work with vulnerable populations, there's many things that are not funded, but are a responsibility and an obligation, particularly when we're talking about a pandemic. I really need the administration to own the fact, when you look at the COVID-related expenses, white minority firms across the board, when the question was asked of the chief of staff, of the mayor, the response was, we were acting quickly and therefore we picked firms. We are going to continue to be more deliberate around this equity lens. We have not met that challenge. And it is very, very difficult for us to want to support, prop up, send a common message that we have the leadership in place and that we're working together when we continue to make decisions that do not reflect that equity lens, do not reflect the numbers, your own numbers and your own statistic. $85 million in emergency funding that we were willing to put on the table whether we were going to get reimbursed or not. And yet this challenge was not considered a priority.
If I can also point out,
Dr. Farley, if I could jump in, it's Brian Abernathy, Managing Director, and council members, your points are certainly well taken. I think there are a few things that we could do better. I think you're right. We could be more deliberate in our contracting and making sure that we provide more opportunities, and we will certainly own that criticism. I think it's well deserved. And I also think we could be, the council president made this point yesterday, Councilmember Parker made it as well, that we should be more deliberate in our partnership with all of you. You have given us great trust and put a lot of faith in the administration and how we responded to this crisis. And we certainly appreciate that. And as we move from crisis to recovery, we need to start to operate differently, be more deliberate, and be more thoughtful in how we work with council and make sure that, again, we're not just speaking to you, but we're actually working with you as we move the city forward. So again, I appreciate those comments. I appreciate the frustration.
Nothing's changed, Brian. We've been in this for 2 months, and time again, it is don't ask for permission, beg for forgiveness. And then when we hold you accountable, we seem like we don't understand what's going on. This is a crisis. We understand that. But how we run government speaks to the values that we share. And this is consistent in all the decisions that the administration continues to make around that equity lens when it doesn't recognize the historical disparities that exist in this city.
Understood.
So as it relates to that, what, if any, opportunities have been offered to the people that are being laid off from the city, particularly frontline staff, for this contact tracing, since you made a deliberate decision that you didn't want to go through your own internal hiring, you wanted to use these vendors, which we all know what the issues are as it relates to that. How, if any, opportunities have been offered to the folks that are being laid off to the city?
So for every opportunity that has been made available, whether it's related directly to the COVID crisis or for other positions within the city, an internal portal has been created for any worker who was laid off. That link has been sent to all of our city staff that have suffered a layoff, and they can certainly apply to those positions and will be given first priority over the public. So we have tried to take those steps to make sure that there are other opportunities for those who have suffered layoffs.
Okay. And then my last question, since Brian took a little bit of my time. Thank you, Brian. One of the challenges we had during the entire crisis was with limited testing available in the beginning. We had countless folks leave hospitals with COVID-like testing symptoms, but could not get tested. Do we have any idea the amount of people that we think may have had the COVID, but were not tested because of limiting testing? Because that gives us a better idea. I'm very, very concerned around the narrative about our numbers and our numbers being low, when in fact, for weeks, people were not offered the opportunity for testing. Do we have any idea, and why did we not require hospitals to give us those numbers so that at least we get a gauge at who we think has been exposed?
So first of all, we do get the results of any test that is done, and any laboratory that does a test on a Philadelphia resident, we get that data. We know that there are many people who had this infection that are not counted in our numbers. Some of that is because many people have this infection that have no symptoms whatsoever, have no reason to think that they should have it, and so they don't come forward for testing. We also know that there was a certain period of time there where testing was very limited. The labs could only do so many samples. There were only so many swabs. That was our biggest limitation. And so I can certainly tell you the total number of people infected is far greater than the numbers we're counting. I can't tell you how much greater it was. I can tell you that we're increasing testing as much as we can from here, but it will always be far greater for all those people who never show symptoms.
Thank you.
Thank you, Council President.
Thank you, Councilwoman. Chair recognizes Councilman Jones.
Thank you, Mr. President. I'm going to shift directions because I think you have gotten the point about contact testing and about the equity lens and about the African-American doctors who stepped up in a vacuum to do testing. So I'm going to shift and say something that you did right. We have, first of all, when I look at the national picture of who's driving the science, I would match you up there with any of them by way of confidence in what you're saying. You got ahead of the curve. It could have been a lot worse in Philadelphia had we not done social distancing in a timely manner, not like other people. But I do not want you to not hear, to unhear what my colleagues have said. Giving also the credit to your staff. There's a part of my district up in Winfield Heights that if you stand on the parking lot of Target and throw a rock, you're going to hit 5,000 senior citizens in any direction, in Inglis House, in Simpson House, in Hayes Manor. And they have been hard hit by COVID. You and your staff helped my staffer work on a collective Zoom call to talk about common threads of problems and common solutions. And we were able to deal with issues like shrinking staff due to COVID impacts. We were able to talk about state standards that we all need to go by. Your staff sent up PPE equipment to facilities that did not have any. So with the bitter comes the sweet. In this case, thank you for what you and your staff did for those 5,000 plus seniors that live in 1 square mile of each other and that needed your guidance, your help to do that. Now, having said that, that's all the compliment you're getting out of me today. Maybe this is a good time to ask for that health center in the 4th District, which I never had. But I'll say that question for another day. What I do want to talk about is how are we preparing to reopen? How is your department preparing to work with small businesses to give them guidance about what the new post-COVID norms are? How do we get those regulations in a handbook in enough time to people so that they can begin to do the things, make the construction, outdoor seating or distance abilities for people to serve people? We need guidance to the small businesses in the city of Philadelphia on how they should operate post-COVID. That's my question.
So first, thank you about the facilities where seniors live. I'll say that's really has been ground zero for this epidemic. Nursing homes have been the worst, and then other facilities where elderly people live together have been really hit hard. And so we worked hard to try to make sure they all have adequate PPE to try to limit the spread within those facilities, and we're going to need to continue to try to do that. As far as your question, we are hopeful that if the numbers continue to look good, that we could go to what the governor calls the yellow phase on June 5th, and that would involve more retail stores being able to open up, for example, among other activities. We hope to have guidance that we would be putting out before the end of this week. So that's just in the next 2 days, that gives people guidance as to how to do that. If not requirement, but it's guidance. I think that just, based on what I'm seeing there, most of the businesses that do that will probably be very pleased to see that. I think that they're more concerned about it being more onerous than it is, but they'll include things like, barriers at cash registers so that people don't, have the droplets hit one another when they're paying for their item. Include requiring masks in stores. That's going to be something very strong. But we'll try to be very specific so people know exactly what they need to do. And hopefully that's in enough advance time so they can be prepared to open on June 5th.
So I hear your suggestions. That's the carrot. You also are going to need a stick. And when people violate social distancing rules, we need to be prepared to address that. I saw nightmare scenarios in other cities where people were in pools and that doesn't have anything to do with small businesses. But the health department will be playing a role post-COVID in how we operate both in business. All right. Matt, I'm telling you, I know you're doing it, Matt. So,
Councilman Jones, it wasn't me, I promise you.
All right, okay. So in conclusion, we need clear guidance also in events. We can't have events like we used to have. So your guidance on how we rewrite those regs on how many people can be at the Mann Music Center, Goodell, the Susquehanna Day, and what's yours, Council Perez?
Strawberry Mansion Day.
Strawberry Mansion Day. We need to have guidance on how we can engage those kinds of activities safely.
What I mentioned earlier, we'll be putting out guidance by the end of this week. Some of that guidance will turn into regulations and requirements, and there'll be some cases where the health department's sanitarians are enforcing those requirements. As far as events, let me tell you that those large events are the things that worry me the most. That's certainly not going to be allowed in yellow. I think we're a long way off to saying that we can have 20,000 people in an arena. That is way down the line. We're going to start with the lowest risk activities, let them start, see how this works, and if we're still seeing good numbers as far as the disease, then we can go into slightly higher risk activities and work our way down on a very gradual, sequential process.
Thank you.
Thank you, Mr. President.
Thank you, Councilman. Chair recognizes Councilman Don.
Thank you, Council President, and good morning, Dr. Farley. And I want to thank you and your team, good morning, for all the work you're doing. I'm going to include Mayor Kenny's administration and Managing Director Brian Abernathy. And look, none of us expected this to ever happen. This is new territory for all of us, and I believe you all are trying the best you can. And I recognize that, and I think so do my colleagues recognize that. I would like you to collaborate more with council, and I want to stand with my colleagues on the issues that they previously discussed. So whatever we can do going forward and be more collaborative and cooperative, I will stand with them and hope we can get this resolved, and I look forward to that. On the smart restart, which we're hoping to get our economy going, including the city and our tax collections and our tax revenues for the city, I wanted to just ask you a few questions. Number one, are you in agreement with, I know there's a hospitality group that wants to close streets to allow either restaurants or whatever to expand and have more social distancing, which I think is a good idea, and I wanted to hear your thoughts on that.
Brian Abernathy may want to weigh in on this as well. It simply said that we're looking into whether that can be done, and there's more implications than just the impact on the epidemic. So I can't give you an answer on that yet.
Yeah. And just to add, Council member, we are actively reviewing those types of proposals. We've certainly seen what other cities have done. My deputy, Mike Carroll, is working through those issues with the Streets Department, Health Department, Police, and a number of our commercial corridors and the Commerce Department to understand exactly what that proposal looks like, and hopefully we'll have something in more detail for you all to review in the next few days.
Okay, I know many of my colleagues, I know Councilman Jones and Councilman Heaton and several others, Councilwoman Parker are all, and Councilwoman Sanchez are all on board to try to get this, help our local small businesses get back on track. So that would be very helpful. And in many cities, I get articles every day from whether it's the Washington Post or other cities where they are doing this already. So we should get in front of this.
Understood.
Okay, thank you. Dr. Farley, one last question. I had a friend of mine, unfortunately, who had a stroke, and it was a serious stroke. And they thought maybe they'd have a week to live, and they died within 3 or 4 days, and the cause of death was the coronavirus, okay? And my question to you is, I was just thinking about that situation. Do we have any idea if the number of deaths non-coronavirus for the city of Philadelphia from March 17th to today are up or down or the same?
So the death certificate data has a fairly long lag before we get it, and so we don't have any numbers for that. I can tell you that each year we have an epidemic of influenza across the city and across the world, and we count a certain number of influenza cases. But then when you look back and when you have all your death certificates in there, you can see that there's a rise, and that's even for causes that may appear to be unrelated. It clearly must have been prompted by influenza. So I think when this is all over and we look back on this data, we will see more deaths that might have been labeled as a stroke or something else, that probably COVID was part of that.
Okay. All right. Well, thank you. And look forward to working with you all. Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilwoman Gauthier.
Thank you, Council President. Good morning, Dr. Farley. I wanted to follow up on this conversation about reopening. I think the last day that I personally was in City Hall was March 13th. If I'm remembering correctly, we had about 4 cases at that time, and it's been terrifying to see over a 2-month or a little over 2-month period that's ballooned to over 20,000. And so I wanted you to explain in detail from a public health perspective all of the reasons that we would be ready to move into a less restrictive phase of opening. And I was hoping that you could speak to both our ability in our success in flattening the curve, as well as our preparedness to do testing and contact tracing in the way that we would need to really open up.
Yeah, so the epidemic rose very quickly, and even though we took some, closed business for the most part on March 17th, the epidemic peaked almost a month later, and so there was a fair amount of continued transmission for at least 2 or 3 weeks after that closure, but it is coming out very nicely now. So what we've shown now is that the way that we're behaving right now, we were able to really slow the spread of this. That on average, each infected person infects fewer than one person. If we keep that up, the numbers will continue to go down. So we could just stay where we are. On the other hand, there are some serious consequences to maintaining a closure as tight as we are right now. I do worry about unemployment. I do worry about poverty. I do worry about hunger in ways I've never worried about before. And so I do think it's appropriate for us to try to very gradually, very carefully see if we can ease back on some of these restrictions to allow people to start to make an income again, to try to solve those social problems without igniting the virus. There's a lot that's unknown here. We don't know. And so the key is then for us to measure every step along the way whether we have gone too far, too fast. We do have systems in place that we didn't have before to be able to measure that. And I think we do need to be prepared. If the virus starts to circulate again, we may need to shut down again.
I guess what I'm asking is, from a doctor's perspective, if you had to make this call, is this the call that you would make? And are these the indicators that you would want to see in the city in terms of us having going into a less restrictive phase of shutdown?
I do. I support it. And because, I'm not an economist. Let the economists worry about them. But there are health consequences to unemployment and poverty as well that I worry about. To put it bluntly, poverty kills too. The virus kills, poverty kills too. So we're trying to figure out what's the right balance there so that we don't, against these two health risks. And no one knows exactly what the right balance is. I definitely think there are states that are opening up too fast, and I'm not supportive of that. I think for this first step to yellow, this is an appropriate thing to try. And if I'm wrong, we will at least have numbers to identify the fact that we've opened up too soon quickly.
Okay. Are we, in your perspective, where we need to be from a testing and contact tracing perspective to open up by June 5th? And what if we're...
So, as far as testing, I should say that we're testing more people per capita than most of the big cities in the country and almost all the counties in Pennsylvania. So we need to test more, but we do have a lot of testing out there now. In the contact tracing, we are just getting started now. I want to do more than that. I do think that we're safe enough to take this first step. I would not call going to yellow opening up. We're still, for example, at that time, I would strongly recommend that we not have social gatherings of any size. So we're talking about people can go to a store. We're recommending that they do curbside pickup. If people go to a restaurant, they can do takeout. We're recommending they wait outside. So it's a pretty limited easing back of restrictions in the hope of trying to get some, people's jobs back without getting people in contact with each other. We'll be pairing this with the very strong messages around wearing masks. And part of that is South Korea, which I think has done the best job that I've seen around the world on this, has a very strong social norm that everybody wears masks in public. And they've been able to open up the economy pretty well, and the virus levels are very low.
Thank you. Can you also talk about our ability to do broad testing in our homeless shelters?
So we have been working in homeless shelters that have problems to do testing. We need to do more testing in homeless shelters. Our ability to do testing continues to increase. And so I think we're not there yet, but I think we're quickly getting to the point where we're that.
When do you think we will be where we need to be?
Let's say 3 weeks.
Thank you.
Thank you, Councilwoman. Sorry. Thank you, Councilwoman.
Thank you.
Chair recognizes Councilwoman Gim.
Thank you very much, Council President. I also want to affirm all my other colleagues in raising concerns about equity and the health outreach, and especially in outreach to our African American and other communities that have traditionally been left out. I think it's a very serious concern about questions that Councilmember Gilmore Richardson and Cheryl Parker and Councilmember Jones have all raised. And I also want to follow up with some of the questions that Councilmember Gautier raised about the reopening. So among the things that's been discussed is not only whether the reopening is safe, but it's also about whether we have the capacity to enforce existing health mandates. I don't agree, actually, that people know what to do right now. I think it's been very clear from numerous conversations that we've had, both with businesses and workers, that there's been a lot of concern about what the guidelines are, how they will be met, whether what people do to meet them will be adequate or not. So it seems like there will be a need for the health department to be active and engaged. So can you confirm whether the public safety mandates will apply to city workers and to workplaces, for example?
Yes, they will. So we will be providing guidance to a variety of different sorts of organizations in different settings, including that would be office-based settings. And so city offices will be following those same guidelines. But I agree with you that I don't think people know yet what they need to do to operate safely. As I said, we hope to get that guidance out by the end of this week so people know exactly what we would consider to be the best practices.
And, in addition to guidance, I think part of it is also around enforcement of some of these workplace safety guidelines. How many complaints has the health department received so far about workplace safety?
I don't know, and I'm not sure that those would all be going to the health department. They may go to other places. We can see if there's a way to log in from 311.
Could we find out whether the city is receiving complaints about workplace safety and get a sense of the numbers? Could you get back to us on that?
Sure.
And can you also get back to us a summary of any responses or enforcement activities that have gone on? For example, yes. I was shocked to hear at a particular nursing home where 2 staff members had died and a number of individuals and occupants of that nursing home had died, that individual staff members who had been tested positive for coronavirus were being ordered to come into work. I assume that would violate almost any kind of public health safety standard.
Well, certainly, we have strongly encouraged the nursing home industry. We don't have regulatory authority on, and we encourage them to have strong sick leave policies and said so that when people are sick, they should not come to work. I absolutely think that they should not be working. We can't force that, but I do agree with you. That is a problem.
So can I clarify? The individual wasn't sick. They had coronavirus, and they were asked to be showing up to a nursing home facility where 2 of their staff colleagues had died of the coronavirus, in a nursing home where multiple occupants had died of the coronavirus. I think that's elevated above paid sick leave. Wouldn't you agree? Like, that's actually a danger to other members of the community. And it is a danger if that individual chooses or needs to take, for example, public transit, or hires an Uber driver, or exposes themselves to other people. So I think this is more than just a paid sick leave violation.
I agree, it is. But I guess the point is that I do have heard of some nursing homes saying, you need to come to work. We need you because we're short-staffed, even though you may be sick or have the infection. And we have strongly said, no, they should not do that. We don't have regulatory authority over nursing homes, but we have communicated that as clearly as we could.
So you feel your position is that the city of Philadelphia or just the health department can't enforce those kinds of standards? You can just give guidelines, but you can do no enforcement?
For nursing homes specifically, it's setting specific. So
okay.
we can regulate restaurants, but the healthcare system is regulated by the state.
That's helpful to know. If you could just give me a summary and share with council a summary of any response or enforcement, and it would help to know if there are carve-outs or other areas, that would be helpful too. So can you speak to one of the things that we've been talking about a lot on council is the importance of stay-at-home orders and the importance of being able to have a home in order to follow and abide by the stay-at-home orders. Can you talk about the extent to which homelessness, housing insecurity, and evictions are part of your department's COVID mitigation and response plan, and whether you're collecting data on the health impacts of housing insecurity and evictions during this time period?
So that's something that is part of the city's response. It's not something the health department is doing. Brian Abernathy may be able to answer that question.
Brian and I have definitely been down this road already. We'll be following up with him, but I think the real question is whether the health department is going to take any ownership or exploration of this area.
I would prefer to be done by other agencies. There are other things that we're quite busy having redeployed a lot of staff to this response, and there are other agencies that are working with housing and homelessness.
Okay, thank you very much.
If I could speak for a minute, this is Eva Gladstein.
Hey, Eva.
Hi. Just to tell the councilwoman that representatives of the health department are working very, very closely with folks from the Office of Homeless Services and other housing organizations in terms of providing guidance and support, particularly around shelter operations. Your point is made. I just didn't want to leave that unsaid.
That's a much more helpful answer. Thank you. Thank you, Eva.
Thank you, Councilwoman. Chair recognizes Councilwoman Brooks.
Thank you, Council President. Dr. Farley, I really want to commend the work your office has done to protect Philadelphians during this crisis. But I want to follow up on the conversation with Councilwoman Gim about the type of spreading that can happen when you go to work with the coronavirus. Can you tell me what your office has done to ensure that workers who get sick can get paid time off to take care of themselves as we move closer to reopening?
I don't know that we have the authority to order that. Other people
recommendations? Any recommendations? Strong recommendations?
Yes, the guidance that you'll see coming out later this week will be. I think we already had guidance, but there'll be clearer guidance that we strongly recommend that people who are sick not come to work, and we recommend that employers have liberal, non-punitive sick leave policies so that they don't suffer economic consequences if they don't come to work when they're sick.
So are you saying that the safety guidance that will be disseminated by your office, as my colleagues asked earlier, will paid leave be encouraged in that guidance?
Yes. And again, I think the wording will be just as I said there, that we recommend that people who are sick not work. We recommend that employers have policies that are liberal, non-punitive, so that they can continue to be paid if they can't come to work because they're sick.
Okay. And another thing, it was reported by the unions representing healthcare workers and transportation workers that they had to fundraise to pay for their members' PPE as the pandemic began. Does the department intend to issue guidelines or mandatory requirements for businesses to provide adequate PPE to workers?
So, there was definitely a period of time when there was a severe shortage of PPE everywhere. It's gotten a lot better. Now, PPE is, different PPE is appropriate in different settings. So, a healthcare worker dealing with a sick COVID patient needs to be wearing an N95 mask. People in other settings, maybe you're wearing a paper surgical mask. In regular workplaces, they should probably be wearing a cloth mask. So we will be making recommendations about PPE in different settings.
Because, I'm a former healthcare worker and a member of 1199C, and I remember that PPE was something you wear one day, one time, and you throw it away. Now we're recommending people reuse things that were previously disposable. So a severe concern with that because that violates all of the guidelines that I remember working in healthcare. So I really think we should really put emphasis on making sure that employers are providing adequate protections for workers.
Yes, if I could say that there's still a lot. I say we're better on PPE nationwide and worldwide. Still, it's a shortage, and so we're encouraging everybody to use PPE conserving techniques. There are ways to safely reuse these supplies, and we're all going to have to get used to reusing these supplies in every setting.
Okay. So also echoing Councilmember Gims earlier, is there a way for a worker to report anonymously to the city if a hospital or healthcare setting violates these rules? And can we be informed about how the city will be responding to those things?
I'll have to see. I'm sure there's a way for them to put in a complaint through 311. I'm not sure exactly what the process is for responding to those complaints. So we'll have to look at that and get back to you.
Earlier, you talked about some other consequences in terms of poverty and around this coronavirus and being stuck in the house. Is there anything the city is doing to address the mental health of first-line healthcare workers that are experiencing death regularly?
There are things that are being done. That's the responsibility of Commissioner Jones and Department of Behavioral Health Services, Department of Behavioral Health and Intellectual Disability Services. So I know there are things happening. I don't know the details of it, so I would just defer to him. I'm not sure if he's on the panel today or not.
Are these things will these things be included in the recommendations that we're offering as we begin to open up?
The current draft does not address the mental health issues. It's really much more focused on prevention of spread of the virus itself. I recognize that's an important issue, but we wanted to get out the key thing about how to prevent the virus spread quickly.
And one other thing, the morgues and the funeral homes around the city have been overwhelmed due to the unprecedented numbers of Philadelphians passing away. We know that the city is enduring many public catastrophes at the moment, like COVID-19, gun violence, and opioid epidemic. Constituents have reported that an overflow has caused a backlog of bodies being transported to proper facilities. And I'm deeply concerned that the delay has increased the costs of storage for grieving families, have to carry the burden of that expense. And we know that victims of the current pandemic are disproportionately Black and brown. Can you say what steps the city is doing to ensure that the overburdened morgues and funeral services aren't shifting the cost of storage to families of the deceased? And has the department explored whether federal funds can be used to mitigate these increasing costs of storage?
We do know that there has been more bodies in morgues at hospitals, as well as medical examiners. Not so much from COVID, but from just the fact that people are not holding funerals because of our stay-at-home order. And so that has been a problem. So the city has leased trailers so for additional storage until people can start having funerals for that. I was not aware of one implication of this being a financial burden on families. And I do not know whether some of the federal funds could be used for that, but we can certainly look into that.
I have other questions, but I'll submit them in writing because my time is up. Thank you.
Thank you. Thank you, Councilwoman. Chair recognizes Councilman Squirrel. Councilman Squirrel. Stepped away. Chair recognizes Councilwoman.
I'm here. I'm unmuted.
Councilwoman.
I kept unmuting. I kept getting muted. I guess we were doing it together. But thank you, Dr. Farley, and thank you, everybody, for your questions and the concerns that we already rehashed. My question is basically, as we go through and we're doing the testing, and once we do the testing, is this going to be a daily testing we do every day for folks to be able to manage this until a virus? Because we know if you test negative one day, the next day you could be positive. So is it an everyday test that we're going to be doing when we do roll out our testing?
Well, testing will be available every day. No matter how much we scale up, we're never going to get to where 1.5 million citizens of Philadelphia get tested every day. My goal is to get up to 5,000 tests a day. We're now at 1,700. And so our testing needs to be available to anybody who is concerned. They can come in and get a test. And then it'll also be more targeted. So with the contact tracing, we'll identify places and situations where someone unknown case was, and then recommend to people who might have been exposed that they be tested.
I'm sorry, sir.
I'm sorry, did you hear that?
Yes, I got it. So I know as we go back out, and we're going to open up gradually and do this. So we'll never get to a point like LA or somewhere where they're testing every day for their residents.
Even LA is not testing every resident every day. I mean, it's still anybody who wants to can be tested, but then they have more specific people that are recommended to be tested. And with our testing, we want to identify as many infections as possible. We recognize we're not going to identify them all. Many of them will show no symptoms. It'll be impossible. And so the testing and contact tracing is one piece of the strategy. The social distancing is another piece of the strategy, and we need to have the two in combination.
Okay, so one on the contact tracing will allow us to test other folks, and anybody who wants to get tested could go to these sites and get tested. So that'll be our progress moving forward. Yes. And then as we deem that, do we see our numbers, because you're testing people who most likely are positive, our numbers will then try to stay the same, or will they go up as far as the positive results?
So, we're tracking not only the total number of people test positive, also, but the percent of people who were tested who were positive. And so if our number of people, can you hear me, council member?
Yes, I'm sorry, again.
Okay, so if we're seeing increasing numbers of people who are tested positive, and wonder if maybe it's just because we're doing more testing, we can look at the percent of all tests that are positive. And if that number continues to go down, then we feel like we're doing well. I can tell you right now, the percent of people tested is going down in parallel with the total number of cases going down. So all of our indicators right now are going in the right direction, and we're going to just watch that. And if they start going in the wrong direction, we'll raise alarm bells.
Okay. All right. Thank you very much. Appreciate that.
Thank you, Councilman. Chair now recognizes Councilwoman Bass.
Thank you, Mr. President. Good afternoon. Almost afternoon. It feels like afternoon. Good afternoon, everyone. I had a couple of questions that I wanted to get to, but first I just wanted to, number one, I want to start by saying thank you to Dr. Farley for the work that you all have done, and these are trying times for all of us. And certainly as the Chair of Health and Human Services, and we've worked closely together on so many things that, your handling of this, I would say, is, it's led us to having not the levels of death and infection that some had predicted for our city. And that's a good thing. That's always a good thing. And so we thank you for that. I do have some concerns, though, because I think that process matters. And we could have done things in a way that would not only be effective and even more effective, but would be inclusive as well. And what we find is that so often in Philadelphia, we're really a tale of two cities. And I've said this so many times before, where we have one part of the city operating one way and having absolutely no idea what it's like to be on the other side, and vice versa. And so this is a time when I just think that we can't afford to go backwards. We have to move forwards. We have to move forwards in a very robust way that's going to bring everyone along finally. And it can't just be lip service. So when we have these conversations and we say that, we're going to do everything through a racial equity lens, and then, we do this nearly $100 million contract, selected by whom, big question mark there. the actions and the words don't even come close to matching. And so we want to get that right, and we want to get it right as quickly as possible. Councilwoman Parker asked that we ask for a list, and I think that this is an excellent point, that we get a list of all minority firms that the health department has contracted with during this crisis, because this happens over and over and over again. It's been my frustration for the length of my time on council, where we say that we want to do things through a racial equity lens. We talk about inclusion and involvement from all sectors of our city. And then when it comes time to issue a contract, rather than making an effort, what we do often is we say, oh, well, it was an emergency, so we had to do this, or, this was important, so we had to do that, or, we'll do it next time. We'll always get to it next time. And for those who are like myself, we're sick and tired of hearing next time. No, this time. And so I think that we need to go back, look at that contract, and look at, what we're doing over and over again, and stop wondering why we keep getting the results that we keep getting in terms of, the lack of participation in African American and Latino communities. We don't get the participation because we don't reach out. We don't do our work. And so it's never going to get better until we make it better. And we rely on our administration to make it better. And so we certainly hope that we can have that list by the day's end. I also wanted to ask you a question in reference to a meeting that I had suggested that you would attend with myself and some other folks from District Council 33. And it's my understanding to date that meeting still has not taken place. And, I just don't understand, the lack of availability to people who are working and trying to be helpful and trying to work together. I do not understand the lack of availability, for some people and not for others. So if you could explain that to me as to why is this a problem? Why is this an issue? Because it seems like a very simple thing to me. As a public servant, we meet with people that we might not want to meet with all of the time. And it's just part of the job. Some of the people we meet with, we love. And then some of the people we meet with, they don't like us. They don't want to deal with us. But meeting is a necessity. And so I don't understand why the meeting requests that we have put forth to date with members of District Council 33 to discuss conditions in city health clinics and city health centers, why that has not occurred.
So, Councilmember, if I can address your first question first.
Certainly.
And just to correct one thing, I don't want anyone to take from this that there's a $92 million contract with any organization. We have contracted out with, or are amended existing contracts to hire contact tracing staff right now. The $92 million is the grant for 2.5 years. It'll be used for many different purposes over that 2.5 years.
I understand it's not even about that. It's really about the way that this was handled.
Yes, and then
the lack of transparency thereof.
And so if these organizations are providing basically administrative services for our staff, if any council member here has a minority firm that can provide administrative services for hiring staff, we would be happy to hear about that and see it going forward. That's an appropriate mechanism for doing the same thing. As far as your second point, let me just say that my chief of staff, Jane Baker, deals with union issues. There's lots of union issues. We deal with a lot of workplace questions. I frankly am not an expert in that, and I am occupied these days in trying to figure out how we fight this epidemic. And so I did ask and would ask that Jane Baker was happy to meet with any of the union members who have concerns. Anything that she can always be a spokesman on my behalf. She's fully empowered to do that. And so that I can focus on the epidemic, I would ask that we can deal with it that way.
I would say to you that, with all due respect, Doctor, that, you being a medical professional, we certainly want to use your expertise to fight COVID. There's no doubt about it. We're doing, I would say, relatively somewhat well as a city in terms of maintaining and keeping the COVID-19 at bay. And at the same time, I certainly do believe that you have a few minutes that you could spare to sit down and meet with the troops. These people are the troops. And so they're offering to be helpful to you. They're offering their services. They're offering their guidance. And at the same time, you as a leader, your presence is requested. And so I just think of myself as the member of Philadelphia City Council. When people ask for my presence, when people request my presence, they're not requesting my chief of staff, my legislative director, my communications person. They're requesting me. And so this request has been made over and over and over again. And I really don't understand, is there some reason why we cannot meet with this woman who is a woman, a lifelong Philadelphian, an African-American labor leader here in the city of Philadelphia, and why we are so hesitant to give her the consideration as someone who is working on the front lines, along with the other folks who are working in those clinics. She is working on those front lines and is assisting and trying to be helpful to you. And so I think that not giving her the time requested is very dismissive and, quite frankly, unacceptable. And I certainly hope that you will reconsider that. I've had several calls with several people from the administration who have all said, yeah, well, you know, this person will meet with her or that person will. No. She's asking for a meeting with the commissioner. And I don't think that that is so far out of reach that it's unacceptable. And I think unfortunately, it's gotten even blown more out of proportion because you just won't meet with folks. And as a leader, I think that you are responsible to have that meeting. Thank you, Mr. President. I'll come back around for my next question.
Thank you, Councilwoman. Chair recognizes Councilman Thomas.
Good morning. I'm going to be very quick because I know I will not get a second round, so I'm just going to ask for 20 to 30-second responses. The first question is, Councilmember Catherine Gilmore Richardson talked about the 6-to-1 number as it relates to people who are socially economically advantaged compared to people who are socially economically disadvantaged getting tested, specifically referring to the Drexel study. Can you just give the audience as well as the members on council a 20 to 30-second explanation as to why that took place or how that took place?
I don't, although I saw a news story about the study, I have not read the study itself. I can simply say that early on, testing was not adequately available in any population. As I said, we had a testing site at Citizens Bank Park, where there were a very limited number of other sites, and people in low-income neighborhoods, it would not be surprised to me did not get as much testing as other folks. It was very limited. Now, at the peak of this epidemic, when people are thinking about this testing, we certainly wanted to test more people, but let's recognize there was a limited value to that. If you have a positive test, we would tell you stay at home, and if you're having difficulty breathing, go to the hospital. We said to everybody anyway, we're under stay-at-home order. So yes, we want to do more testing. Yes, it was not adequately available, but that's the situation we were under at the time. Now we are been working hard since that time to make it more available in low-income populations and in other underserved populations, and we're going to continue to work on that.
So I think there's a common narrative that, not even going to go there. Let me stick to the questions. The next question, when you look at what's going on as it relates to mental health, you talked about that being a specific issue. What is the timeline? Again, 20 to 30 seconds, please. What is the timeline as it relates to availability to grooming initiatives? When will people be able to get their nails done? When will people be able to get their hair done? And what would the recommendations be around what that stuff would look like? Again, 20 to 30 seconds, please.
Personal care like barbershops and salons are not included in the yellow phase. We think that's a higher risk activity. That would be when we get closer to what the governor's calling the green phase. We're not putting any timeline on that. It really depends on whether the numbers continue to look good. So I know people want to be able to do that, and I'm sympathetic to that, but I feel like it's too high risk an activity at this point.
Next question. So we're looking at the possibility of different professional sports opening up. That's going to send a message to constituents all across the city of Philadelphia, but especially our young people. What mechanisms are the health department essentially looking to put in place so that young people could participate in some level of activity this summer while properly social distancing? The attachment to that question is, has the health department looked into the idea of having some type of social distancing champions or advocates that enforce social distancing so we're not relying on police officers to do that? Please try to answer that one in about 30 seconds because I do have to make one more statement before I close out.
Yeah, in the yellow phase, I believe the outdoor group activities for children are permitted, and there will be guidance in there about how that can be done in a safe way. It's something we need to be very careful about, but I do think that would be permitted. That's very different from a professional event. That's not a competitive event. There's no spectators there. So it's a very limited way to allow children to get some physical activity and the benefits of that. We'll put guidance out there. We're not in a position to be able to enforce that. We would welcome any suggestions people have about how people involved in those activities can enforce the rules.
And council member, the city will be is actively exploring social distance ambassadors to get to your point about the police department not just enforcing those rules. So stay tuned on that. But that is coming down the pike.
Thank you. I appreciate it. As I close out, I just want to, again, put the emphasis on the importance of collaborating versus consulting. A number of council members made some passionate speeches today that were actually similar questions and concerns that I had, not just as it relates to how we're distributing contracts, which is very important, but the overall message that we're sending the city of Philadelphia. When we communicate numbers like 6-1 as it relates to the disparity in testing, when we talk about the issues that we're seeing with contracts and the unemployment issues that we're seeing, we have a lot of members of city council who on a consistent basis are actually being ridiculed and slammed by the public for decisions that we are essentially not a part of. And I think the frustration that you're hearing right now is that people have been entrenched in different areas of this work, and the fact that we sometimes find out information very late because it's communicated and there's not collaboration. I think that's the frustration that you're hearing right now. So I just want to echo the sentiments of several of my colleagues who communicated the frustration that we're seeing. And I, again, want to reiterate the importance of some type of task force specifically focused on the African-American community so we can do a deep dive into the issues that people are essentially dealing with, but most importantly, so the African-American community in the city of Philadelphia has and recognizes that there are people that are out there that are fighting for them and that are advocating for them. My time is up. Thank you. I appreciate it.
Thank you, Councilman. Dr. Farley, I have a couple of quick questions before we go to the second round. Phase yellow, Governor. I think it's a little too soon, but I'm not a healthcare professional, just happen to be a person that's a citizen of the city of Philadelphia. But there were numbers that were given by the governor early on about the numbers we should achieve prior to us moving to the next phase. I don't think we're at those numbers in the 14 successive days. Correct me if I'm wrong. And in addition to that, I guess I need to know what level of flexibility, because in all due respect to the governor, understanding he represents the state of Pennsylvania, city of Philadelphia, Montgomery County, close proximity, but there are differences. There are differences in terms of the conditions in the city of Philadelphia, differences in the people, differences in those impacted by this particular virus. So I'm concerned about the decision that was made to move to yellow in this particular time frame. So can you tell me what level of flexibility, if any, we as the city of Philadelphia have, and not necessarily going as far as Montgomery County or Berks County or some of the other counties that are not as impacted as we are?
Yeah, that's a very important question. The governor put out the one metric of 50 cases per 100,000 cumulatively over 14 days. That's kind of like the one metric out there. I was always uncomfortable that we would follow just one number, and I think that there's probably a group of numbers we ought to be following. I did look at the metrics that were recommended by various national bodies about what should be used to determine when it's okay to open. And there's a lot of variety to it. But on one end extreme, it was if your case numbers are falling for 14 straight days. Well, we've been falling now for more than a month. So by that criteria, we're ready to move. So I think there's room there's enough uncertainty here. There's room for judgment about whether we're ready at that time. In my judgment, we are to take this very first step in trying to restart some of our businesses in a very safe way. As far as your second question, though, I think you should talk to the chief solicitor.
Before you go to the second part of your response,
yeah.
I'm not only talking about businesses. I'm talking about gatherings. I believe that there are other aspects of it. The businesses, for a lot of different reasons. I'd like to see us get back to work. I'd like to see us get some additional revenue in the city because we're bleeding revenue. But some of the other aspects of what the governor has proposed, and I'm a little concerned about that. So it's not just businesses.
Yes.
Are you comfortable with 25?
I completely share your concern. My understanding is that the gatherings of 25 people are allowed in yellow, and would not be my recommendation as a health commissioner that we have gatherings of up to 25 people. That is, a social gathering where people are not wearing masks, that could be a very high risk situation right now. We know there's a CDC report of a choir practice where they had about 60 people, and in the space of a couple hours, 50 of them got sick, and 2 of them died. So a social gathering can be quite a risky situation. So whereas that would be allowed by the governor in yellow, I'm not recommending that. But that leads to the second half of the question. That is, my understanding is that we can be more restrictive than the state is. We certainly can't be more liberal. And so I do think as we get into these phases, we need to look and see, do we think what the governor allows is what we should allow, or should we be more restrictive? And certainly on the social gatherings, I believe as a recommendation, we should certainly be more restrictive. And as we go forward, there may be other circumstances where we should be more restrictive.
All right. And the other part of my question, I don't know, may require city solicitor or legal in some respects. The ability to impose certain mandates, like going into facilities without masks. Do we have the ability locally to require every indoor facility that has certain capacity, people wear masks? Because that's clearly something that's been discussed. And in terms of if we do have the ability, I guess the enforcement side, I'm not sure if it would be more Mr. Abernathy or Health Department. But we can have all the rules that we want, but if there's no real enforcement, then it really doesn't matter.
So let me just say, as a health commissioner, I think we should have it be where everybody who's going into an indoor environment is wearing a mask. And I think we do need to bring in the city solicitor about exactly what our authority is to mandate that. I do think that we can make a social norm so that that's what people do, in that way it's enforced by other people around there. The analogy I used the other day was, we want to get to where people wouldn't walk in a place without a mask, and the way now they wouldn't walk in there without a shirt. There's probably no law that says that, but it's just not done. If you did that, probably the owner of the business or the place would say, get out of here. That's where we need to get with masks, and I think we can get there.
All right. Mr. Abernathy, you want to talk about the enforcement side?
Sure. So we do believe that we have some enforcement capacity and capability. And so whatever executive order we issue will have some enforcement guidelines in part of that order as well. Enforcement is going to be challenging, and I just want to put it out there. I don't think we want our police officers to try and enforce the wearing of masks, with actually physical force or arresting individuals. I don't think that is the message we want to send to our citizens. But so we are going to have to try and find that balance, and we're going to make some mistakes as we go through the enforcement. But I think we are all committed to making sure that we do this, we do it to the best of our ability, and we make sure that folks comply, because this is not, as we saw the other night up in your district, we still have some real challenges that people don't understand the danger that this virus causes, and we need to make sure that that behavior starts to change.
Well, I wasn't going to bring this up, but I think the police response to that particular incident was a little overdone.
Fair enough.
So since you brought it up, my district encompasses Rittenhouse Square, where you see gatherings every day, right, on any warm day that are beyond recommendations. So I don't think you should have used that as a particular analogy.
That's fair.
So I've talked to the mayor once and asked him about some sort of enforcement. I'm just concerned, we're sending a signal, and then, you walk in a building, you have a mask on, and some people do have masks, some people don't, depending on the degree of the mask, if it's an N95, whatever, you're protected to a large degree from other people. But if you have a mask that people are selling at these small corner stores, limited, cloth mask, bandana, doctor, that you're really only to some degree stopping the droplets from coming from yourself, and they're not necessarily protecting you from incoming at any real degree. So I'd like to see us have a little more thought process, and I know you all are thinking about that, but a little more guidelines as we move to the next phase, because some people are just not going to comply. That's just the nature of what we are as human beings, but, we really need to let people understand, not asking police officers to, arrest anybody not wearing a mask, because police officers don't arrest people smoking weed on the corner. So clearly I'm not thinking that would be the case, but we do need to establish some sort of guidelines. All right, thank you.
Mr. Council President, if I could just have one point of clarification. When we're telling everybody to wear a mask all the time, it's really is about protecting the people around them. The principle is my mask protects you, your mask protects me. And with that in mind, a cloth mask is adequate for that. It stops the droplets, most of them, from coming out. It doesn't protect you so much, but it does protect the people around you. And because we can't give N95s to everyone anyway, and people they wouldn't want to wear them, we're fine with cloth masks in the typical, workplace setting.
All right, but that requires everybody to wear a mask.
Yes, it does.
That's
absolutely.
Yeah. Okay. All right. Thank you, Doctor. Chair recognizes Councilwoman Gilmore Richardson.
Thank you so much, Council President. I wanted to just circle back to a few things before I move on and quickly get this on the record. But I just wanted to say that if we are serious about combating institutional racism, generational poverty, and lack of inclusion, we must all agree, not just from a council perspective, but from the administration's perspective, we must agree that we have to do better. So particularly on the issue around the contracts with PHMC and PHMCC, wanted to know if we can get a commitment on the record today for the administration to support a process for both organizations to hire community-based businesses and individuals who are skilled in that line of work. And are they planning to partner with some of those community-based organizations, or are they just going to take the contract specifically for their organizations?
Those organizations in this context are serving as administrative function to hire staff that we choose, the staff that we hire, okay? They'll end up, they pay the bills. We choose the staff that we hire. So they're not going to be subcontracting with other organizations. They're just going to be hiring staff.
Okay.
I'd like to just jump in briefly. So of the staff we've hired thus far, we've only hired 13 staff. Are you able to hear me?
Yes, I can hear you.
Yeah, we've only hired 13 staff thus far. Of the staff that are hired through these agencies, a majority are people of color, 38 are multilingual, and we've hired 3 supervisors, all of whom are Black women. So
I appreciate that information. I really, really do. But we have to understand the real way to combat generational poverty and assist individuals with generational wealth is by ownership opportunities and getting a chance at those contracts. Okay? So I just want to move on so I can get to my additional questions. I wanted to thank...
Councilwoman, 1 second. I've just been informed by the public hearing police that our timeline, joke you all, a little levity never hurts. We still have 2, 3 actually departments, so we have to kind of limit on this second round to like 3 minutes, and as quickly as possible get in, get out, because we still have behavioral health, Office of Children and Families, and DHS, and we only have an hour left.
Okay, thank you, Council President. No, thank you so much. And just quickly, I'll put these on the record. To echo the sentiments of my colleagues Parker and Bass, if we could get a list of all the contracts in the health department, every contract, whether it's amended, the date of the contract, the length of the contract, the amount, and the reason. And then also quickly around the data, like my colleague, Councilmember Brooks, I too am a former healthcare worker and wanted to know how we look at the numbers to ensure that our numbers match with the state numbers, knowing that our reporting times are different. And if you could explain how the city is prioritizing testing for the long-term care healthcare workers and how the data is reported. And then lastly, I wanted to follow up on a question from Councilmember Dom around how we are ensuring deceased individuals are not being misclassified as COVID cases. So for instance, when I worked at the hospital, I was a unit secretary. I was in charge of preparing the death certificate for the doctor. So the doctor would put down the diagnosis or list them in order. So how do we ensure that individuals aren't being misclassified as COVID cases when in fact they die from another cause? And that's the end of my questions. Thank you so much.
Thank you, Councilwoman.
Now, do you want me to respond to them, Council President, or
as quickly as possible? Yeah,
as far as misclassification, the hospital is required. They fill out the death certificate. But even with that, there may be people who are died from COVID that are not recognized because they weren't tested, for example. So I do expect that when we ultimately look back and estimate that there will be deaths that must have come from COVID that were never classified as such. And I don't think there's any way for us to solve that on each case basis going forward. As far as the long-term care facilities, let me say we are working with the long-term care facilities citywide to help them implement facility-wide screening of residents and staff. That's it's a strong recommendation, which may become later a requirement. We think it's a good thing. There's 47 nursing homes in the city. There's a lot of them. They have limited resources. We're going to assist them as much as we can. We think that's a good thing. And as far as contracting, let me just again point out if there are organizations, minority organizations that you feel can serve the administrative function that we're using PHMC for, PMACC for, we're happy to look at that and see whether that would be an appropriate way to channel these funds.
But Council President, I apologize. I have to say this, but I think we have to continue to open up the opportunities for other individuals. We can't always rely on referrals from members of council when you don't let us know until we find out in a public hearing. Thank you, Council President. My apologies.
It's okay. We'll follow up on that one. Thank you, Councilwoman. Councilman Green, in 3 minutes, and we got to move it along.
Thank you, Council President. I will be somewhat brief. Dr. Farley, in the budget detail on, I believe, page 146, you have allocated some funds for the Black Philadelphia Health Initiative to be determined. What is that line item?
I'm sorry. I'm going to ask Sammy Giroff. He can enlighten me here.
Yeah, so that's an initiative focused on reducing health disparities in the city, run out of our chronic disease and injury prevention program, and no vendor has been selected. That's a planned expansion for the new fiscal year.
Okay. Also, I just find it very interesting that the Health Commissioner's staff was able to quickly put together numbers that have been hired by PHMC or PHMCC, but we still don't know the number of people that have been tested in the city of Philadelphia. But I will move on. On page 37 of the budget detail, $3.9 million is allocated to a new city health center. Can you give some perspective where this new health center will be located?
Yes, we've long advocated for, and the mayor announced in the past that there would be a health center in the Northeast, in an area there that is very much underserved. Our health center 10 there sees roughly twice as many patients as every other health center in the city, and it still is overwhelmed that we have very long waits, and so it would serve the additional patients that need to be served in that population.
Council President, I have a number of other questions, but myself and Councilmember Bass have co-sponsored a resolution regarding the disparities based on ethnicity and COVID-19 response, and I'll explore those issues at that time. Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilwoman Parker.
Thank you, Mr. President. A number of questions, Dr. Farley, I will submit them to you in writing, but wanted to emphasize on the record what Council Members Jones, Squilla, Dom, Sanchez, Johnson, Green, and I have been consistently talking about relative to guidance for neighborhood-based small businesses. Right now, as they have been trying to access dollars via loans and via grants, they're trying to figure out what they need to invest in. Last week, I circulated to members of the administration and my colleagues just a general outline of what Tampa has done relative to its reopening in a pilot area relative to restaurants. So we need to get that done as soon as possible, and your guidance is extremely important. In addition to that, council members Brooks and Gim noted that the calls, and I know all of my colleagues have gotten these, Dr. Farley,
Farley. I won't name the firm that my constituent worked at, but she called me on the telephone via cell to say, I'm at work and we are working around food and all of us don't have on gloves and masks. I said, well, did you go tell your supervisor that you are concerned? She said, someone did that and they were fired. And so with that being said, I want to affirm the need for a hotline and oversight about what the repercussions will be when we find out any firm doing business in the city of Philadelphia is not doing it with public health in mind and the public safety of its workers. Even though the healthcare industry is regulated by the state, as we are working via our intergovernmental cooperation and planning, we need to tell them that we need a standard operating procedure that we can establish across the board, because employers need to know the rules and regs as well.
Thank you.
Thank you, Mr. President.
Thank you, Councilwoman. Chair recognizes Councilwoman Gim. Councilwoman Gim.
Council President, I'm withholding my question and I'll submit it in writing.
Okay, thanks, Councilwoman. Chair recognizes Councilwoman Brooks.
Council President, I'm also withholding my questions and I'm submitting in writing.
Okay, thank you. Thank you all so much. Dr. Farley, thank you. We'll be following up with a number of those very important issues, either in the callbacks or based on these responses we get from questions asked in the hearing.
Thank you very much.
Thank you, Doctor. Not clear. Next up, we're going to have the Behavioral Health and DHS and Office of Children and Families. Who's testifying exactly?
I believe Council President, I believe this is Commissioner Jones. I believe I'm up next.
Commissioner, you're testifying for behavioral health.
Correct.
And then who will be testifying for DHS?
President Clark, this is Cynthia Figueroa, Deputy Mayor. I'll be doing the introductory statements for the Office of Children and Families and DHS, and I will have Kim Ali with me.
Okay, cool. All right, thank you. Thank you. Please proceed, sir.
Yes, so good morning again, Council President Clark and members of City Council. I again, David T. Jones, a Commissioner for the Department of Behavioral Health and Intellectual Disability Services. On the call with me are both my Deputy Commissioners, Roland Lamb and Jill Bowen, along with the CEO for Community Behavioral Health, Donna Bailey. We actually, I have submitted my written testimony, and so I will make just a few very brief statements in the interest of time. I want to certainly acknowledge the DBH-IDS staff who just have really, under this pandemic, has really performed exceptionally well. So I want to acknowledge them. And I also want to acknowledge the network of mental health, addictions, intellectual disability, and early intervention providers who have continued to render services during this pandemic. As understandably so, a number of the questions have really focused around the response to the pandemic. There are two things in particular that I would like to point out that the provider network, I think, that we put in place to support the provider network, and it's important because while certainly there has been emphasis on what the response has been, and it's the response relative to kind of all the other things that are occurring. One of the things that we did as a department, and obviously very much in collaboration with the administration, was to put in place what we refer to as an alternative payment arrangement for our provider networks, in particular the mental health and addictions providers. The reason that APA arrangement was critical is that we had conversations as the pandemic hit with our provider network, and what they said to us was, so Commissioner Jones, we feel like we may be able to eke through the end of March. But by the time we get to April, recognizing that there won't be the same number of kind of face-to-face visits, and that we feel like we won't be able to provide services in the same way that we may have to, in fact, lay off staff. And so this was a concern that they were expressing around having to reduce the number of clinicians that would be available when we knew that there would be a surge in terms of anxiety, stress, and kind of other behavioral health needs coming to the forefront. We were able to work the state and then and certainly community behavioral health did an exceptional job of issuing what again became an alternative payment arrangement, where we were able to look at this vast array of providers, their annual kind of, or monthly, I should say, expenses. We arrived at kind of an average and then added 3%. That allowed those providers to keep staff employed, who then in turn provided various behavioral health, mental health, and addiction services, obviously, to Philadelphians. We obviously, that was not going to be able to be done face-to-face, and we feel like we were real fortunate in working again with the state and others where they relaxed the regulations around telehealth, and so the services that are being provided have continued to be provided more telephonically or through various video conferencing platforms. And so that telehealth, so whether you're talking about some of the work in terms of, we know that there were questions around, ongoing support for students, ongoing support for people who had kind of various behavioral health diagnoses. We certainly looked at as we looked at the triangle where there tends to be an 80, 15, 5, which is 80% of the population doing pretty well, generally experiencing obviously heightened anxiety and stress during the COVID, 15 that were more at risk and that they had actually had previous challenges, and then that top 5% where they actually had ongoing both mental health diagnoses and addictions challenges. And so what we're able to do is to through that network of providers is really move forward with implementing telehealth in a way that would be responsive to the broader community, so that again we instituted programs or we work with providers to institute programs where they were able to do again more call-in, that folks who had more ongoing addictions issues, that we increased mobile capacity. So in some instances, we actually were having medication be transported to individuals who may have had, for example, opioid use disorder. So I wanted to just let council know, and we certainly tried to do that in a way where we were in the spirit of keeping you guys informed and updated in a collaborative way. We sent over letters or certainly information to convey what we were doing, the actions that we were taking, so that you all could be informed and certainly would then have the opportunity to reach out and ask questions as they may have come up. And so I will pause there, Council President, and certainly am open to receiving any questions. The only other thing I will say is that I want to circle back to the question eventually that was asked from Councilwoman Brooks of Dr. Farley, who just, by the way, I just for my colleague, I just want to say, I really feel like he has been doing an exceptional job in leading through this pandemic. He has, as he always is, has been present. He cares deeply and always is willing to kind of step up sometimes and carry the load to take sometimes some of the hits for some of us that, I just want him to know that it's appreciated and want to be on public record of stating that. And so, again, I will pause and open up for any questions from council.
Thank you, sir. And we concur with respect to Dr. Farley, but, we all take hits with the job we do, and that's a part of why we do what we do. As leaders takes hits, and you take them and you keep it moving. But thank you for that comment. Commissioner Jones, the Health Choices Fund, is that within your jurisdiction?
Yeah, yes, Council President. So the way that works, as you are familiar with, so community behavioral health serves as the behavioral health managed care organization for the city of Philadelphia. It is both, it's essentially kind of quasi-government in that it's a 501c3 nonprofit. You just to put some numbers on it. So as you very well know, City of Philadelphia over 1.5 million. Community behavioral health provides kind of oversees Medicaid, and so for any Philadelphians who are eligible for Medicaid, they would really be the payer for behavioral health services. At last count, in terms of eligibility, we were upwards of about 718,000 Philadelphians eligible for Medicaid. So representing about 46% of the population. As you well know, it speaks to the remarkable resiliency of Philadelphians, and then clearly the deep need, as evidenced by you guys' anti-poverty plan.
Okay, and we really appreciate that and your participation in that program. The managed care funding from the state has a budget increase of $100 million. That will bring the FY2021 proposal to $1.3 billion. Is funding stream threatened by the COVID-19 crisis, as a number of other commitments are?
So this is actually this is our Medicaid funding, and part of what you see in terms of the increase is an appropriation of what we would anticipate receiving if there are additional Philadelphians who become eligible for Medicaid. So it's really, it's part of the Affordable Care Act, as you well know, and, presumably, as long as that continues to move forward, if we get additional, again, Philadelphians who become eligible, we want to be able to pay for their behavioral health services, and that's the purpose of that appropriations request for increase. But again, it's all Medicaid dollars. I should also quickly say that just as a reminder to council, the DBH IDS budget is it's about 56% state fund, 43% federal, and then the 1% that about almost 15.5 million. That is the general fund, and those are match dollars that the grants in terms of both the Medicaid and primarily the grant dollars require in order for us to draw down the funds. So for essentially every $1 that the Philadelphia puts in for general fund, you get a $9 return from our various state and federal dollars.
And the 16.8 million budget increase described as contractual costs for potential expansion. Is that a part of match requirements?
That is primarily, that would be Medicaid dollars.
That would Medicaid dollars. Okay. All right. Thank you, and thank you. And you've always been very responsible, and appreciate the good work that you've been doing. Let me see where we are. Chair recognizes Councilwoman Parker.
Thank you, Mr. President, and to you, Commissioner Jones, and Bailey, who's on the line, and all members of your team. Thank you so much for your work. Commissioner, I just need to state to you on a record and publicly that pre-COVID-19 in January, we were talking, we meaning my staff team, we're having a conversation with two long-term employees and mental health professionals in Nicole Connell and LaVan White about the number of constituents who were coming into our office with mental health challenges, and that we wish that there was a way for us, even as frontliners who interact with the public, to know what we should do and what should be our standard operating procedure. And they were knocking on the down saying what you need is something called the mental health first aid training. You have to get this mental health first aid training. So on February the 24th, I, along with all of my staff, went through the mental health first aid training provided by your team. Malik Gray was the person who facilitated our day-long training, and he did an awesome job. We didn't know that he would be helping us in advance of this when people call afraid or scared about some of the trauma associated with COVID-19, but it was very helpful, and I want to say to you and your team, thank you for that, Dr. Jones. I wanted to say it publicly. With that being said, I also want to ask you the first question, and the first question is about what I mentioned in my conversation to Dr. Farley. What is being done during this time to provide support to providers, in particularly minority-owned and operated providers? Since we know the trauma added on what people were already experiencing, this COVID-19 pandemic, what kind of supports are being offered? Because I was, as a result of Dr. Farley's testimony, I went back, Doc, and you know this well, the 1932 experiment, and there is a lot of minority communities relevant to government and traditional supports. So what are we doing to support minority providers who are on the front lines in providing supports to the constituency that has been disproportionately impacted by coronavirus and COVID-19? What are we doing to support those providers?
So first of all, thank you, Councilwoman Parker, for your ongoing leadership and your staff's participation in mental health first aid. I think that we and more want to encourage as many Philadelphians to participate in mental health first aid. And just to be real clear, so mental health first aid helps provides information so that people are better able to understand kind of the psychiatric, when somebody presents in psychiatric crisis, how to respond to that individual, how to offer support, and then how to direct that individual to the support and services they need. I think that so I want to thank you for that, Councilwoman Parker, again, for your staff participating. And also, that's also part of how we are responding, whether in terms of the various both behavioral health providers. We are continuing to take approach where we're looking at kind of a prevention and intervention, and then making sure that folks get connected to treatment. And so we understand the disparity that exists between certainly communities of color and connecting with behavioral health services. We have really done a lot to really try to combat the stigma that prevents folks from seeking treatment to begin with. Part of our strategy has really been, and this is both, it's a strategy as it pertains to getting people connected to behavioral health, but it's also kind of an economic strategy, and that is we have partnered with people with lived experience. So whether we're talking about peers who are certified peer specialists or certified recovery specialists, to then have those folks more out in the community, and this, even as we're doing this pandemic, to have them on virtual networks sharing information about what's available to address and deal with the additional anxiety and certain stress that the pandemic is providing. So we have done that work.
The buzzer just went off, so my time is up. Again, I want to just commend you and your team for your work. I want to just note for the record that we have to be very intentional in relying and including minority-owned and operated providers. I think about one, I think it's in Councilwoman Gaultier's district, the consortium. I know I have one in my district, and they have multiple locations called West in the Logan area. And I don't want to see us commit the same faux pas that I think we have already made. I want us to be intentional about making sure that any emergency response that we provide to address supports and services for those in need, that we include those people. In addition to that, I want to get this on the record. Before COVID-19, trauma was a huge issue here in Philadelphia, and you can respond to this in writing. How is DBIDS continuing to address the issue of trauma amidst the COVID-19 pandemic? And you can respond to that in writing. Thank you so much, Mr. President, for your leeway and the time.
Thank you, Councilwoman.
And if I could just again thank Councilwoman Parker. We will get those responses in writing. I just want to just be real quick to be on the record that we certainly have been very intentional engaging with providers like that Councilwoman Parker mentioned, WEST Consortium, CCTC, other minority providers. We have been very intentional. As I said, even as we develop the alternative payment arrangement, we actually had conversations with some of them, and they were ones that said that this is the kind of action that we would need to take in order for us to be able to provide service through the pandemic. So I just want to be clear that we were very intentional, and thank you.
Thank you, Commissioner. We're at 3 minutes now because we still have Commissioner Figueroa to testify. Chair recognizes Councilwoman Fiona Sanchez.
Thank you. Good afternoon, Commissioner Jones. I too want to just echo the sentiments and confirm what you have just finished saying. Your willingness over the last few years to really work with some of these providers and around building capacity and quality, cultural competency, and language access has been huge in districts like mine, and I appreciate it. Particularly appreciate the alternative payment as people move to telephonic services and telemedicine in communities where the accessibility we've seen be highlighted during COVID-19. So thank you. I would be remiss, and I'll have to use some of my time, and then I'll leave you with the question that you can submit in writing. We've spent quite a bit of years talking about trauma-informed care and intervention strategies at the school district. And I know during this budget crisis, people are not going to see one of the major accomplishments that, with your support and your collaboration from your department with the school district and our ability to have intervention specialists at the elementary and high school level to support our children. And it's going to get lost in all of this. I will assure you, as chair of education, I will remind folks the value of that, because having participated for many years to get to this point has been huge. And I just really want to thank you, and I look forward to that process. I know it's going to be bumpy as we look at the new normal and when and where children will be in our school facilities. But I look forward to that challenge and that conversation. So really want to just to highlight that, because it's so important for principals and others to be able to count on some of these providers that we're talking about, right? Being able to provide that culturally competent intervention at the school is going to be huge for families. So thank you very much. I have a question. I know you don't always get consulted or some of these decisions around how we move around some of the addictive services and the intervention strategies, but you know, I watched as we put into action the removal of the homeless population at the airport, and I know you've been working with us at Kensington, but really wanted to ask, you know, I've been seeing this for years, the notion that until we get housing for all of the folks in Kensington is the only way that we're going to be able to restore Kensington is one that I have rejected. I continue to push back on the administration who's allowed, you know, these 300 folks to live, many who are not from the city. And again, I will push back on the administration and their position, particularly when they changed policy around getting people's original address. But what, if anything, can we do moving forward around providing support for families to take their loved ones back? I am of the belief that we really need to pilot something different that helps us meet families where they are. But this notion that the only way I'm going to clean up Kensington is if we get housing for those 300 people when we have 17,000 people waiting in PHA is quite daunting. And so really want to work with you this year on what does that look like and how do we work with some of our advocates on the ground. I don't always agree with all of the advocates on the ground, but I absolutely do not deny their good intentions and their love and commitment to the folks that are in Kensington. But I represent the people who live in the buildings in Kensington, and I just feel like we have had an unbalanced approach. So please submit to us what we're going to do different about providing support to families for them to take their loved ones back home, as opposed to us with this policy that we're going to house everybody. Thank you very much, Dr. Jones.
Thank you, Councilwoman.
And if I could just say, just to express my gratitude to Councilwoman Sanchez for working with her office. I certainly, I hear you. I think that we have really tried to be accommodating in terms of doing some things specific for District 7, recognizing some of the long-standing challenges. Her leadership has been great. What I will say is that the idea around permanent supported housing, though, being a pathway is something that we agree about, and we certainly will come to the table bringing all innovation that we can to kind of help solve problems. So,
thank you,
sir.
To recognize Councilman Jones.
Thank you, Mr. President. And thank you for all you do. I, too, my office also had that mental health emergency kit treatment, and it was phenomenal. It prepared us for a great deal of the public concerns that walk through our door every day. But it did not cover what we anticipate and will have post-COVID. So I have a couple of quick questions. Number one, how have you developed a plan for when people come out of lockdown?
So, Councilman Jones, so first of all, I live in District 4, so I always appreciate your work, and so I want to be on record with that, and certainly appreciated your staff's participation in MHFA. You guys were early out the gate. Appreciate it. Yes, so we are obviously what we feel like will help us in terms of our strategy moving forward. What we hope and what we can also use you all's help is that they continue in terms of relaxing the regulations around telehealth. We feel like that is actually the way behavioral health services will be delivered going forward, will be a much heavier reliance upon those platforms. And so what we need to have is the availability of that additional, again, whether it's Microsoft Teams, Zooms, FaceTime, whatever it may be, that there's legislation and regulations that allow that. We anticipate that there will be a pretty significant surge, actually, once we get on the other side around, again, with increased anxiety. What part of what we want to be able to do is to use the provider network that we have to then allow them to be able to be responsive, but not be in a place where they are, until this is kind of figured out, putting their staff more at risk in terms of kind of that face-to-face. I mean, obviously, they'll be practicing physical distancing. They will continue to make sure that all the other preventative measures that the health department and others have suggested, that we're practicing those. But we really feel like that telehealth, in terms of a strategy going forward, is really going to be the platform that we build behavioral health services on, and we'll need your help.
So we have, all of us in this council, know somebody that has been impacted by COVID-19. One of the individuals that I know grew up with came off of it and did, after the shock of the fact that he was in a coma for 11 days, felt very weak and vulnerable mentally. Is there some kind of post-COVID, you come off of that ventilator, how do you suggest people help folk, other than them getting on their knees thanking God that they survived it? How do they get their confidence back that when they walk out the door, they're not going to contract it again?
Yep. So 2 resources that I want to be on record as stating. So first of all, through community behavioral health, we continue to have that 888-545-2600. So 888-545-2600. That number is personed 24 hours, 7 days a week, 365 days a year, so that as individuals come out if they feel like they need support. And they could call that number and then get connected, particularly if they have public health insurance, get connected to treatment. The other piece is that even as we are, we have taken advantage of May as Mental Health Month, and we are pushing out mindfultogether.com. Mindful Together, that's MINDPHL together.com. It is a website that actually has a lot of information, and in part, it actually includes online screening that an individual can go on, anonymously take from essentially a checkup from the neck up, that then will say, so the anxiety that I'm continuing to experience, is that typical under the circumstances, or is it really exacerbated and maybe I need support? It gives you, after you take, it's a very brief screen, after you complete it, it makes a recommendation around whether you need additional support or not. So those are just two resources that are readily available right now.
Thank you, Mr. President.
Thank you, Councilman. We're running out of time. Chair recognizes Councilman Dom.
Thank you, Council President. I'm going to try to keep this to 2 minutes. And if you could, Commissioner Jones, good morning, and thank you to your team. Your response in 30 seconds would be great. So here's my question, budgeting question. The city's on shaky grounds this year financially. One way the administration has said they'll make ends meet is by eliminating unfilled positions and instituting a hiring freeze. Budget details. From more than 1,800 only have 1,500 employees back in the DBH had children and even more. They're currently budgeted about public health at 700 employees paid through their own extra about 500 positions. They're working the budget. That's just today's points. Why we do have some of those workers budgeting millions of dollars for positions that have never been filled?
So I think, as I think has been expressed, and thank you for the question, Councilman Donald. I think that we are in a situation where you're having to make really difficult decisions that are far less than ideal circumstances. I think there will be, as Brian and others have indicated, I think there will be every effort made to have any displaced workers have an opportunity to apply for those vacant positions, and I think that will be the strategy that we try to move forward on. Obviously, we will try. We are committed to being a great fiduciary in terms of our fiscal responsibilities, and that will continue.
Let me just ask this one question, or second question, just to confirm. We have 400 unfilled positions that we're keeping in the budget currently. Is that accurate?
So to be clear, Councilman, I can't speak to the positions that are in health nor DHS. You have, I think you have both Cynthia and Kim, who are right behind me, and I'm sure they can speak to that, or we can respond to it. Okay. For us, for Department of Behavioral Health and Intellectual Disability Services, it really, we were budgeted previously for, I believe it was 291. In this current, we increased by 7 to take us to 298. Most of those, and in fact, all of those are kind of essential positions, a lot where our acute services, so it's the unit where we have who responds when there are people who are expressing suicidal ideations and that kind of thing. That's where most of our vacancies are, and we're trying to fill those.
All right, do me a favor, just send us your answer to the Council President. And thank you very much. Thank you, Council President.
Thank you, Councilman. And I believe that's all the questions for you, Commissioner Jones. Thank you very much. I'm sure we'll be getting back to you. We have a lot of questions that we needed to follow up on.
Thank you, Council President.
Council President.
Oh, Councilman Green, somebody told me you left. I'm sorry.
No, I'm here. I was after Councilmember Dom.
Oh, okay. Yeah, I'm getting bad intel. Sorry. Go ahead, Councilman.
All right, Commissioner Jones, real quick. Thank you for the work you have done throughout your tenure with the city, especially during this pandemic. You, as well as Donna Bailey from CBH, has always been very responsive. I can say the same thing for Cynthia Figueroa and her office. I know I probably won't get a chance to ask questions to them during this time. But I do want to echo what Councilmember Parker talked about in reference to culturally competent providers. And so you know my thoughts regarding that issue. But I do have just a general concern regarding mental health and drug and alcohol concerns coming out of this COVID-19 pandemic. There was an article in the Inquirer about outreach and the concerns that because of sheltering in place, people don't have the traditional supports they have, drug and alcohol support for those who are recovering, as well as for those that have any physical learning differences like autism. I just want to get your thoughts briefly regarding how we're dealing with COVID-19 from those two communities, especially as we report and start to move beyond sheltering in place. That completes the question.
I'm sorry, Councilman, I couldn't hear the tail end of your question. You kind of tailed off a bit.
So my general concern is what are your thoughts in reference to those with drug and alcohol challenges, as well as those that have physical or learning difference, especially like autism, which is the community I represent? How will we be able to address those issues during COVID-19 and as we move forward beyond COVID-19?
So very quickly, Councilman Green, continue. We certainly have appreciated working with you and your leadership around, and in particular, people who are on the autism spectrum. I think that, again, what we certainly are going to have a more heavier reliance on telehealth, particularly to get us through the pandemic. We have had our provider network. They have continued to deliver services through that platform. I think that part of what we certainly will have to do is continue to work with families and providers to see what they feel like works best for them under these circumstances. We'll continue to work in as a collaborative manner as possible. And then I don't want to shortchange your response. So what I'd also like to do is just offer additional feedback via a written response. Councilman Green.
Thank you, Council President. Thank you, Commissioner Jones. That concludes my questions.
Thank you, Councilman. Thank you, Commissioner. Appreciate you. We'll be following up with a number of other issues. Thank you very much.
Thank you, Council President.
We believe we do have Ms. Figueroa is up next, and we'll probably not be able to get all our questions in for Ms. Figueroa. So again, we do have callbacks time. Ms. Figueroa?
Yes, and we're happy to take any questions in writing, and we'll respond as soon as we receive them. Good afternoon, President Clark and members of City Council. My name is Cynthia Figueroa, Deputy Mayor for the Office of Children and Families, and I also have with me today Kimberly Ali, the Commissioner of DHS, and Nadine Parisi, who's the CFO of our office. The Office of Children and Families is comprised of the Department of Human Services, PHL Pre-K, community schools, and out-of-school time. We also partner with the school district related to the Education Support Center and our truancy intervention providers. We've also worked really hard during the COVID pandemic. As many of you are aware, we've collaborated with the school district to ensure there's youth meals and worked in partnership with the Managing Director's Office to make sure that there are general food distribution sites as well as food for vulnerable communities. We're also working hard to make sure that there is, in fact, a summer. We haven't given up on summer and working diligently with the Health Department and the Managing Director's Office to support this work. We are happy to report that our revised budget, while it demonstrates some confusion from the budget numbers, I want to be very clear that it eliminates any planned expansions. There is no expansion of PHL pre-K slots, and there's no expansion of the community schools. We're actually going to remain at current levels in those programs. The Department of Human Services continue to make tremendous progress. 4 years ago, I testified about the double-digit increases of children placed with the department, and today I'm proud to report that based on all the strategies, there's 11% fewer children in DHS placement than 1 year ago today. We know a majority of children are with kin. We've dropped our congregate care rate below the national and state average of 9.4%. And we continue to support the work of our young people who are in the juvenile justice system. So I'm making my comments very brief because I know there's a few people that have questions and recognize we have about 8 minutes to do the impossible. So I thank you, and I thank all the council members who've been incredibly supportive of our office during its development and during the key strategies during this pandemic.
Thank you. Thank you very much. Chair recognizes Councilwoman Gim.
Thank you very much, Council President, and thank you, Cynthia. I'm sure we'll just put on the record that I think we'll do a callback for DHS because we can't possibly cover all the questions right now. But very quickly, a couple of highlights to hit. One, I'd love to talk to you just separately about a complaint we've been receiving that KUA workers are scheduling visits during school time. And so because school is so compacted right now, there's only a few opportunities for children to get online. They don't have school all day long. For example, they may only have one class at a time. When a KUA visit conflicts with schooling, that becomes a real problem. And we've seen a little bit of reluctance or what appears to be some anecdotal indication that there's been not a lot of flexibility on that front. So if we can work with you on that privately, offline, that would be great. I wanted to thank you for the work that you've done in terms of reducing young people in placement, in particular, after the death of 16-year-old David Hess at Wordsworth. CBH and DHS have really worked hard to address the situation within many of our residential treatment facilities. I know we've done a significant and heroic amount of work together, not only on the local level, but on the state level. And I really want to thank all my colleagues on council who've been an advocate on that, particularly Councilmember Johnson. Safety is our number one concern. But as the coronavirus lockdown has, really impacted a lot of young people, as we see facilities and counties all across the state of Pennsylvania really taking radically different approaches towards how seriously they're taking, the impact of the virus. Have we been able to go out and visit these facilities to determine whether or not, appropriate safety measures are in place? Has DHS been able to ascertain what the contracting protocols, for example, are going to be or will be in the future? So if you could just address that. And then, Council President, I'm going to submit the rest of my questions in writing.
Thank you so much.
Right. I'm going to have Commissioner Ali talk about the congregate care providers and the work that's being done in regards to the COVID response. I know that there's been ongoing communications with the providers. So, Kim?
Yes, good afternoon, Councilman. In terms of our response as it relates to COVID-19, the Department of Human Services have been working very closely with our congregate care providers. That also includes our detention center, the PJJSC, in which we looked at every young person who was placed in congregate care to determine whether or not they were able to either be discharged to a community-based alternative or returned home to their family. I'm happy to report in terms of the PJJSC alone that 185 young people were reviewed by the courts, and 76% of them were discharged from the PJJSC. That is a number, 101 young people. In terms of congregate care facilities, we did that also on both the dependent as well as the delinquent side, and has been successful in discharging young people who were able to return home. All of the congregate care providers have submitted to the department as well as to the state a continuity operations plan that we have on file at the department. We also been meeting with them once a month to determine what does their recovery process looks like. So congregate care providers, as we speak, are working on their recovery plans.
Thank you. Chair now calls Councilman O.
All right, thank you very much, Council President. For anyone representing DHS, Deputy Mayor, or Commissioner, I want to know about the where Philadelphia is regarding Family First Prevention Services Act, and in particular, has the City of Philadelphia made an application for Family First Transition funds?
So I'll take the first part, and Kim, if you want to add anything. So the Family First Prevention Services Act is a federal legislation, and the state has to make the determination to opt in. The state has now pushed back its implementation of Family First for almost about another year. So originally it was supposed to be implemented in October of 2020, and now it's pushed back to July. So we're working closely with the state, and we've been preparing for quite some time.
Oh, okay, I'll let the question be answered. I just want to narrow it down a little bit. So my understanding about states, as you described, but also the counties. So the funding of $500 million to assist states also goes through counties. New York City, in particular, has applied and anticipates $40 to $50 million this year. $40 to $50 million. And in the meantime, while it did join with 38 other states to request a waiver, the consequences of the Family First Prevention Services Act is in play, with funding available on the front end and limitations for group housing, which is where New York is coming up with the reimbursement of 90% of its losses, anticipated losses in its current system. So could that be explained? Because my understanding it's a limited pot of money.
So, Councilman, I just want to clarify, because there's what is called the Family First Prevention Services Act, and then the Family First CARES Act that was related to the COVID. And I think there's been sometimes confusion between these two different funding streams.
Yeah, I'm not confused. Family First Preventive Services Act, which then is being supplemented through funding of $500 million, which goes to county through state application through the Family First Transition Act.
Right, so that's correct. So we can't draw down any money unless the state has opted in, and the state is not opting in. And so if the state doesn't opt in, the county cannot draw down any of the prevention resources available.
Okay, if someone can explain to me later, because I'm running out of time, how is it that New York State has applied for a waiver? They didn't opt in. They applied for a waiver. They should be in. Maybe they did, and then New York City has made an application. So I'll let you answer that, offline.
12:30.
Okay, thank you. Thank you very much.
Councilwoman, and we're actually going to, Deputy, we're going to call you back.
Okay.
Questions. I know some members opted out because of the time frame. But real quick, if Councilwoman Brooks and Bass, if you could just quickly ask your questions and we can get responses in writing, and then we'll have you back. Councilwoman Brooks and then Councilwoman Bass, and then Channel 64 is going to bump us off of here.
All right. Philadelphia has already had the highest rate of child removal of any big city in the country. I want to commend your office's stated commitment to reducing the number of children in placement and reducing the number of young people held by JJSC. When young people are able to stay safe and home and healthy with their families, everyone benefits. However, as parent and grandparent, I worry about the destabilizing effects, including the massive wave of unemployment and increased housing insecurity that COVID-19 has had on families. What proactive strategy is your office using to reduce the number of youth in foster placement and JJSC? And how are you adapting these strategies in light of COVID-19 crisis and its aftermath?
Thank you.
So I'll just say quickly that I started my opening testimony by saying that we've reduced by 11% year over. When this administration started, we had double-digit increases. So we're pleased that and I'm happy to put in writing all the strategies. So thank you for the question. We're 100% committed to the same issue.
Thank you.
Thank you. Thank you, Councilwoman. And Councilwoman Bass.
Thank you, Mr. President. Thank you, Cynthia. I just wanted to actually add the exact same question. in terms of, we have the highest displacement, particularly of African American and Latino youth, and the reunification in the face of a pandemic. What does that look like? And so I look forward to getting something in writing that really details and outlines what your strategy is for continuing that in a much more robust way. I think 11% is okay, but if you're, a family member who has been away from your child for a long time, then that's, it's forever. So if you could address that in writing, I'd appreciate it. Thank you, Mr. President.
Thank you, Councilwoman. And again, I just want to apologize for having this very limited opportunity, but we're trying to get as best possible callbacks, but it's out of all of our control. So, Deputy, be prepared to be called back, because I know yours is one of the departments that there are going to be a lot more questions. Sure. So thank you very much. That we will stand in recess until 3 o'clock for public testimony, and I must warn you all, you should eat lunch because there are a lot of people that have signed up. Thank you. See you at 3.
All right, thank you.